Good morning to everyone. We warmly welcome you to the second series of this year's webinar entitled A Decade of Success Ahead. In our previous webinar, we learned about the current road safety management and policy directions in the country. Today, we will take a closer look at our roads, mobility, transport systems, and vehicles, and gain new knowledge from the project results of the health burden of road crash in the Philippines under the National Institutes of Health, UP Manila, and the Department of Health. Let us all rise for the national anthem.
Bayang magiliw, pelas ng silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiging, sa manlulupig, di ka pasisingin, sa dagat at bundok, sa simoy at sa langit mong bakaw, may nilagang tulaan namin sa paglayang minamahal, ang kisag ng matawad mo'y tagumpay na natinig, ang bituin at araw niya kailan pa may di magdidilig, lupa ng araw ng walhati pagsinta, buhay ay langit sa piling mo, aming ligaya na pag may mga api, ang mamatay ng dahil sa'yo.
I am Sophia Francesca Lu, and together with me is Dr. Jinky Leilani Lu, and we are your masters of ceremony for today. Road safety is everyone's responsibility and should be everyone's priority. To begin the program, may we call on Dr. Jinky Leilani Lu to introduce the Executive Director of NIH for a welcoming message.
She is a research professor at the National Institutes of Health, UP Manila, as well as a clinical professor and head of the Division of Clinical and Metabolic Genetics at the Philippine General Hospital. She also served as Vice Chancellor for Research of UP Manila from 2014 to 2018. Dr. Cuchonco de la Paz was a 10 Outstanding Young Men Awardee in the field of genetic medicine in 2002. In the same year, she was recognized by the National Academy of Science and Technology as one of the outstanding young scientists in the Philippines. She was awarded the Outstanding Women in the Nation's Service for Medicine in 2007. Dr. Eva Maria C. Cuchonco de la Paz is currently the director for the health program of the Philippine Genome Center and executive director of the National Institutes of Health. Everyone, Dr. Cuchonco de la Paz.
Good morning, everyone, and welcome to the second webinar series on this road safety. We are very, very happy of the very successful first webinar, and today we continue this series of 4 webinars. Thank you so much. We now have from about 900 last week. We now have more than 2,000 registrants. So congratulations to Dr. Ted HERBOSA, as well as our dear research faculty, Dr. Jinky Lu. And I wish this second seminar to be as successful as the first. And we look forward to everyone's participation in the next webinars to come. Thank you. This is as lifelong learners, this is a golden opportunity for us to learn more about road safety and make sure that we are part of the prevention of road crash injuries not only for ourselves, our families, but also for the whole country. Thank you very much, Dr. Jinky, for this opportunity to give the opening remarks again.
Thank you, Dr. Cochonco. We now have a greeting from the Secretary of Health of the Philippines, Honorable Francisco Duque III. Honorable Francisco Duque III is a Filipino physician and government official serving as the Secretary of Health since 2017 and previously from 2005 to 2009. From 2010 to 2015, he served as the chairman of the Civil Service Commission.
Good morning to our distinguished guests, partners, and to everyone joining us in this webinar. The changing circumstances as to how Filipinos move and go about their everyday lives have underscored the importance of ensuring road safety for all. According to our online National Electronic Injury Surveillance System, or ONICE, transport and vehicular crashes remain to be the top cause of reported injuries. The onset of the pandemic has only further emphasized the need to improve the safety and accessibility of our road networks. There are many ways we can improve road safety that go beyond the obvious reduction of preventable and related injuries and deaths. We must explore the option of making our roads more equitable and improving pedestrian access to the streets for almost 90% of Filipinos who do not have access to cars. In light of this, your Department of Health recognizes the urgency in developing policies that draw on the principles of inclusivity towards building healthy communities. While the DOH continues to expand its efforts in health promotion and preventive care, we also recognize that the path to road safety will involve working with various stakeholders from our national government agencies, civil society organizations, and the private sector. We have to ensure equitable access to our roads, but to also ensure that people share the road safely. We are fully aware that improving road safety will entail a comprehensive reform in plans, policies, and infrastructure. However, as we continue to work on such reforms, we should remind ourselves that the duty of improving road safety is a responsibility shared by everyone, especially by the users who traverse the road networks daily. So let us all work together to achieve better health outcomes for every Filipino and ensure health-promoting and equitable developments in the country. Together, we can secure the safety of the Filipino people, no matter where they go and how they get there. Maraming salamat po.
Thank you, Honorable Secretary Duque. Thank you as well, Sophia. Sophia Francesca Lu, my co-host for today, is a lecturer at the University of the Philippines, Diliman. She is a PhD candidate at the CARS-Q, Queensland University of Technology, Australia. She is also a co-proponent of this project on road safety. We are pleased
to announce that last week, on the day of the first webinar itself, we had a total of 1,305 registrants. As of today, we have a total of 2,020 registrants from all over the country, representing various sectors of society and coming from various walks of life. Road safety is a common knowledge to all of us. Our life on the road is our everyday reality. Road safety is everyone's responsibility and should be everybody's priority.
We also have the Director for Disease Prevention and Control Bureau for the welcome remarks. Dr. Beverly Bev Lorraine Ho is the Special Assistant to the Secretary of Health for the Universal Health Coverage at the Department of Health, Philippines. Immediately prior to this full-time designation, She was Chief of Research Division of the Health Policy Development and Planning Bureau, where she worked to provide the evidence needed to support health system reform by designing innovative research grants and building institutional capacity for policy research. Bev is a fellow of the Maurice Greenberg World Fellows Program at Yale University, the Equity Initiative, and the Atlantic Institute. She holds an MD from the University of the Philippines and an MPH in Health Policy and Management from the Harvard T.H. Chan School of Public Health as a Fulbright Scholar.
To participate in this webinar. Good morning also to Dr. Ted and Dr. Jinky, who's spearheading this work. A pleasant and healthy morning to all of you. From the DOH side, as mentioned by Sec Duque and USEC Villaverde, we're really very happy with this initiative, and that's why the DOH continues to support research or research translation initiatives like this, because these will be very essential in policymaking. Transport is an essential part of our everyday lives, and particularly during this pandemic, this was uncovered. No, the importance of this aspect was highlighted. And we know that we all spend a lot of time going to work, going to school, places of leisure, even worship. And so while our time on the road has greatly been reduced during the time of the pandemic, it has emphasized the very critical role of making sure that roads are safe, not only for transport, but people who actually walk, no, for pedestrians. We also know that many Filipinos continue to be pedestrians, no, or owners of non-cars. So that would be bicycles and motorcycles. So as such, road safety remains a very great concern, especially for 90% of Filipinos. Cyclists and pedestrians are among those 90% and are most vulnerable to road crashes and related injuries and deaths. So due to concerns for road safety and inequity, the road remains inaccessible, we know, and unsafe for many vulnerable sectors, including our senior citizens, persons with disability, lower income families, and women and children. So we at the Health Promotion Bureau and the Disease Prevention and Control Bureau of the DOH, in cooperation with the national and local governments, civil society, and the private sector, have leveraged our current circumstance to fast-track the initiatives on road safety reforms through the promotion of active transport. Research and on-the-ground experience has shown that installing certain interventions, no, such as bike lanes and promoting active transport through other means, can significantly reduce road crashes and related injuries and fatalities. In addition to the benefits of active transport on our health, no, reducing non-communicable diseases, its impact on the environment, no, less carbon footprint, and also transport efficiency, and of course economic recovery, which will again, no, circle back to having health impact. So as our secretary has already said, improving road safety reform needs to have impact or work at the various levels, and we look forward to getting a lot of insights, inputs from these four series webinar sessions. Our team will be joining you in all of these sessions, and hopefully through this platform, we can really build partnerships, or we can grow our work together and make sure that our roads become safer, more equitable, and more accessible to every Filipino. So maraming salamat po. And my teammates, Maddie and Dasha, will be here to also help answer your questions if there will be any. So thank you very much. Good morning.
Thank you, Dr. Ho, for those words of encouragement. We now have the overall program leader to give us opening remarks and the webinar overview. Dr. TEODORO Ted HERBOSA was the Health Undersecretary from 2010 to 2015. One of his most important accomplishments during his term was helping achieve universal health coverage. He also led the modernization of public hospitals through Health Facilities Enhancement Fund and the public-private partnerships. He was the Executive Vice President of the University of the Philippines System from 2017 to 2021. During his term, He had several accomplishments as a chair. The university hosted two international conferences and strengthened relations with Southern Taiwan University. He further expanded knowledge of the university on the road safety emerging interdisciplinary research and created the UP COVID-19 pandemic response team. He's currently a special advisor to the Philippines National Task Force against COVID-19 and also a professor of emergency medicine and trauma surgery at the UPPGH.
Thank you once again to all of you who are taking time and initiative to be part of this webinar series on road safety. And of course, to the Honorable Secretary Francisco Duque III and Dr. Beverly Lorraine Ho of the Department of Health who graced us with their welcome remarks. As Filipino people, we use roads every day to get to work or school, to go to church, to run for groceries, and even to get to our favorite leisure spots. Whether we walk or we ride, we are all road users. Likewise, we are always on the move, whether as commuters, passengers, drivers, or pedestrians. Mobility is integral to one's freedom, movement, and productivity. This right to mobility is anchored on the right of being safe on the road. About 1.25 million people around the world die from road crashes each year. Nearly half of these casualties are the most vulnerable road users, pedestrians, cyclists, and motorcyclists. According to the World Health Organization, among people aged 15 to 29, road crashes are the leading cause of death worldwide. Highly preventable, yet road crashes remain a public health concern. We have organized a 4-part webinar series on road safety grounded on the 5 pillars of the UN Global Plan for the Decade of Action for Road Safety, which are road safety management, safer roads and mobility, safer vehicles, safer road users, and post-crash response. Last week, May 26, we had our webinar 1 on road safety management and policies. We had our speakers from the World Health Organization, Australia, and we heard from the Secretary of the DPWH, Yusek Pastor of the Department of Transportation, and the Philippine National Police. We are pleased to announce that on the day of webinar 1, we had a total of 1,036 registrants that participated via Zoom or our Facebook and YouTube links. Today, we have more than 1,305 registrants. This shows how road safety is close to the heart of the Filipino people. Today, our topic is on safe vehicles and mobility. Safe vehicles is not only the key here, it is also ensuring that all of you have the right to mobility. This is facilitated by an efficient transport system that will take you as commuters and road users to your destination safely and faster. The Asian Development Bank identified the main challenges that the Philippine transportation faces, which are 1. The quality of road network. 2. Presence or absence of efficient intermodal integration. 3. Quality of urban transport systems. And 4. Lack of road space for commuters. Hence, we need the DPWH for good quality of road networks and the Department of Transportation for good intermodal integration. Haven't you noticed that getting to our final destination is quite difficult as commuters daily? The public utility vehicles, the MRTs, the LRTs are not seamlessly connected so that we walk distances to get to the next segment of our ride. Data from the Department of Transportation shows that an average of 276,128 passengers board the MRT every day. Good intermodal connection will definitely reduce the time that people have on the road and in the long run will reduce road crash incidents. Remember, as well as mobility is a right of every human being, hence, we need to improve the mass transport system through infrastructure development of MRTs and LRTs, and to reduce both public and private motor vehicles on the road. As a result of this, traffic congestion will also be reduced. A Japan International Cooperation Agency study projected that the economic cost of traffic in Metro Manila to reach up to 6 billion pesos daily by 2030 if the situation continues. Overall, in partnership with the Department of Health and the UP Manila National Institutes of Health, we want to be able to achieve three things with you in this four-part webinar series. First, raise awareness and create policies based on the findings of the evidence-based research, the epidemiology of cases of road crashes and injuries in major tertiary hospitals in the Philippines, and constructing an index for road safety based on the epidemiology of hospital injury cases, surveys, and road management, and how these findings are able to translate in real-life situations on the road. Next, using the whole-of-society approach to road safety, we believe that all of us, from the common people, the barangays, the local government units, to the leaders of our national government agencies, public and private sectors, institutions, all of us, road users, have a role to play in promoting road safety. Lastly, we want the Filipino public to know more about road safety in the Philippines, the current policies, and private and public plans in the near future. This is also a space for the Filipino public to know their rights and responsibilities when using the road and how they can contribute to make it safer for everyone. On June 9, 2021, we have the post-crash response and safer road users. On June 16, 2021, we have the evidence-based research and programs on road safety. Join us as we bring road safety closer to the Filipino, now more than ever. By being part of the AHEAD Road Safety webinars, we are creating a great platform that will help us achieve our goal, the zero vision, a future with no fatalities or serious injuries involving road crashes.
Thank you, Dr. Herbosa. We still have a lot to do to reverse the increasing trend of fatalities related to road crashes and support long-term activities promoting road safety from the local to the national level, including developing safer roads, mobility, efficient mass transport system, and safe vehicles. Surely, road safety is everyone's responsibility and should be everybody's priority.
We encourage everyone to join us across all our sessions. You may register at the Zoom link or by scanning the QR code on the screen, as well as through our Facebook and YouTube link. Please also see the link and scan the QR code on the screen for the question and answer. Stay with us throughout this webinar as we will be sharing the evaluation form link later. In the Philippines, we have the Health Burden of Road Crash Injuries program led by Dr. TEODORO Herbosa and Dr. Jinky Leilani. Today, they will be sharing some key initial results from this program, along with distinguished speakers from the DPWH, LTFRB, MMDA, LTO, and PNP to talk about road safety.
The Department of Public Works and Highways spearheads major infrastructure projects, including design, construction, and maintenance of national roads. To give us an overview of the country's safer road infrastructure, we have the Undersecretary for Technical Services from the DPWH, Engineer Maximo L. Carvajal. Undersecretary Carvajal obtained his engineering degree from the University of the Philippines. He has served more than 3 decades of public service as an engineer, project manager, project director, component manager, assistant secretary, and now the undersecretary.
Morning. Am I coming in clear?
Yes, very clear.
Okay. So, can I share my screen? I cannot share my screen. Please authorize. Okay. You see now my screen?
Yes, yes.
Okay. So, good morning, everyone. On behalf of the Secretary of the Department of Public Works and Highways, Secretary Mark A. Villar, we would like to thank the Department of Health and the University of the Philippines, Manila, for organizing this event. This is quite timely considering that the number of issues on road safety seems to be growing unstoppably. Let me start off by providing a glimpse of the current state of road safety in global context. Based on the report published by the WHO in 2018, around 1.35 million lives are lost each year because of road crashes. Road crash is the number one killer among young people aged 5 to 29 years old. It is also the eighth leading cause of death for all age groups, surpassing HIV/AIDS, tuberculosis, and diarrheal diseases. The report also highlighted that the burden of road traffic injuries and death is disproportionately borne by vulnerable road users and those living in low and middle income countries. These numbers shows that the number of road crash related deaths remains significantly high. Despite efforts to mitigate this global challenge, the result is still short of committed global target of reducing road traffic deaths by 50% by 2020. The number of road safety situations in the Philippines basically follow the same global trend. Data from the Philippine Statistics Authority shows that since 2006, the trend of road crash deaths in the country is steadily increasing. In fact, since 2010, the number has never gone down below 8,000 mark. On the other hand, crash data sourced from the Philippine National Police for 2016 and 2017 shows that Luzon, there is high incidence of fatal road crashes being recorded in regions 3 and 4A, while in the Visayas region, more fatal crashes are occurring in region 6 and 7. And in Mindanao, it's region 10 and 12. Here in Metro Manila, based on the MMDA crash database, road crashes have been on rising trend for over 10 years since 2005. In fact, the numbers nearly doubled from 65,111 incidents in 2005 to 110,025 in 2007. These significant numbers could be expected since almost 25% of the registered motor vehicles in the country is in Metro Manila. What is more notable is that majority of these reported road crashes involve motorcycles. With all these global and domestic trends on road safety conditions, it's obvious that there is an urgent need for government to scale up road safety efforts to catch up with commitment under Sustainable Development Agenda for 2030. In response, the Philippines has formulated a national road safety strategy with clear goals and targets to address road safety issues, and this is embodied in the document known as the Philippine Road Safety Action Plan. The Philippine Road Safety Action Plan, or PRSAP, was initially formulated in 2011 in response to the global call of the United Nations for the decade of action for road safety. The goal of this road safety action plan is to reduce the number of road crash deaths by 50% in 2020. This plan was subsequently updated by DOTR in 2017, strengthen the framework and make it more responsible to committed targets. The PRSAP consists of 5 pillars that are supposed to fit in a framework that would contribute to a safer road environment. The framework is anchored on the safe systems approach that aims to develop a road transport system that is capable of accommodating human error and one that takes into consideration the vulnerability of the human body. The safe system approach also promotes the general principle of shared responsibility among different sectors of society to achieve sustainable goal for road safety. The DPWH, for example, were entrusted as the lead agency in charge of pillar number 2, which calls for the safe planning and design of roads as well as the improvement of hazardous locations. Generally speaking, the road safety strategy of the DPWH is anchored on the safe system approach being promoted under the Philippine Road Safety Action Plan. The DPWH strategic roadmap shows the framework designed to achieve the vision of becoming an effective and efficient government agency. We believe that for us to be effective and efficient, we need to provide services and deliver projects that bear significant social impact to the public. This is the reason why road safety is primordial concern for DPWH. Apart from reducing travel time and providing disaster-resilient infrastructures, improving road quality and safety is one of our 3 major strategic objectives. Having a safe environment is something that every Filipino wants to achieve, and we intend to provide this by adopting safety design standards in the planning, design, construction, and maintenance of our roads, particularly our national highways. The adoption of both proactive and reactive approaches in road safety has been recognized in the international practice. The reactive approach is focused on providing treatments for existing roads, for the proactive approaches intended for roads that are yet to be built or constructed. Providing treatment for existing roads can be done at 2 independent strategies. One is for road sections with high occurrence of incidents, commonly known as the accident-prone areas, or technically called black spots. The other one is for high-risk areas, or those road sections with notable risk factors. Having expounded on the basic road safety strategies and targets of DPWH, let me share with you how exactly we could incorporate safety in the design and construction of our highway system. Ideally, roads can be made safer through the awareness of safety principles during the design stage. The first goal of a safe road design is to ensure that road users remain safely in the road. This will depend on the following factors: sound road surface, adequate width or cross-section, good alignment, good visibility and appropriate delineation and signing, provision of facilities for vulnerable road users, management of conflicts of intersections, and speed control and management. However, it must be recognized that drivers and riders are only human and will sometimes make mistakes and lose control of their vehicles. Therefore, the second objective of safe road design is to provide a forgiving roadside free of potential hazards that may injure the occupants of vehicles that accidentally leaves the road and subsequently enters the roadside. We need to provide a forgiving roadside by making sure that all potential hazards identified are properly treated, and forgiving roadside becomes more important on higher speed roads because the severity of crash with the roadside hazard increases rapidly with speed. Now, let me try to give you a status of where we are as far as implementing our road safety process is concerned. Let me start with road safety audit. Road safety audits is generally based on the basic principle of prevention is better than cure. It is a formal process where we look at independent and qualified team auditors to examine and document across accident potential and safety performance of road. The road safety audit can be done at different stages of the road development cycle. RSA can be applied on existing road or on ongoing road project. It can also be applied for roads that are yet to be built through audit of the design plans. Since 2010, we have been conducting road safety audits of our existing national highways, and this has been a regular activity for the department as part of the development of our accident prevention program. As of 2019, a total of 25,958 kilometers of national roads were already subjected to RSA, which is equivalent to about 78% of the total length of our national highways, or about 33,119 kilometers as of October 2020. Apart from road safety audits or inspections, the PCHRD-DOST recognizes the potential of the International Road Assessment Program survey in the treatment of high-risk road sections. The IRAP survey produces road star ratings based on road inspection data and provides simple measure of the level of safety which is built in on the road for different types of road users such as vehicle occupants, motorcyclists, bicyclists, and pedestrians. Generally, the 5-star roads are the safest, while the 1-star roads are the least safe. Just to give you an idea, the following picture will describe how different road star rating looks like. These are pictures taken during the previous survey conducted by ARA here in the Philippines. Another road safety process is the accident black spot investigation. It is basically a reactive process of responding to an existing problem. The DPWH accident black spots investigation handbook uses the term black spots to refer to all types of hazardous locations with high road crash risk. Black spot location could either be an intersection, road section, or even small areas with higher than average road crash rate. The treatment of hazardous locations is strategic program of the PWH, considering that this particular responsibility was inscribed as one of the commitments under the Philippine Road Safety Action Plan. In the updated CY 2017 DPWH PTS scorecard for the treatment of black spots, the target is to treat 1,100 black spots in 5 years. It is being projected that eliminating these black spots would provide potential accident reduction of about 25% in 20 years. This commitment was based using our traffic accident recording and analysis system crash database as of 2013. Based on our last updates, considering that last annual crash records provided to us by the Philippine National Police for 2018, we have identified about 2,676 black spots in our national roads. We recognize that the identification of road safety program through recognized road safety process becomes useless if we do not have sustainable funding source to implement these identified programs. The department has clear policies and guidelines, and so far as integrating road safety features in all projects under our regular infrastructure program. In addition to this, the MBUC fund is an important augmentation fund that is being tapped also for road safety treatment programs, particularly for existing and completed road projects. It also includes the integration of road safety features in all our projects assisted by foreign-led institutions such as the ADB, JICA, World Bank, and others. This is how the Department of Public Works and Highways is trying to comply with its share of responsibility insofar as providing safer road infrastructure is concerned, consistent with Pillar number 2 of the Philippine Road Safety Action Plan. Nevertheless, the success of every road safety strategy lies not on the fragmented strategies but on concerted efforts directed towards a common goal. The Philippines has set its road safety target aligned with the United Nations Decade of Action. The PWH is responsible for only one of the 5 pillars. We cannot do it alone. The government and other road safety authorities, NGOs, LGUs, the academe, consultants, contractors, and other stakeholders must come together. Together, there is great chance that we can achieve the target. Together, we can accomplish something big. Together, as one, we can save millions of lives. Thank you very much and good morning.
Safer mobility requires ensuring that commuting is adequate, safe, convenient, and environmentally friendly. The Land Transportation Franchising and Regulatory Board, or the LTFRB, is mandated to provide us with dependable public transportation services. Our next speaker is the chairman of LTFRB, Attorney Martin B. Delgra III. Attorney Delgra III obtained an economics degree in 1981 and finished his law studies in 1987, both of which from the Ateneo de Davao University. With more than 28 years of law practice and litigation work, Attorney Delgra has handled various cases and concerns in the field of labor law, criminal law, administrative law, and corporation law. And he is more than adept in providing us with the LTFRB's programs and strategies regarding safely commuting.
Good morning, Dr. Jinky. Thank you very much for the introduction. And good morning, everyone who are here present and those who are following us on social media. First of all, we would like to thank you for the opportunity given us to share LTFRB's programs that have been put in place since the time we assumed office, from the time this administration came into office. There has been a lot of programs that we need to address insofar as road safety is concerned. And I would like to say, perhaps to predicate our discussion here, is that road safety is a concern of everyone, not just for motorists, not just for government for that matter, for DOTR or LTFRB, but for all of us, motorists, pedestrians, commuters, cyclists, everyone who are, especially those taking the road. And for that matter, it is for everyone's education that we need to know not only our rights and obligations, but also to understand how we would be safe on the road, depending on who we are and what we are doing insofar as road safety is concerned. So may we share the screen for our presentation. Okay. When we talk about road safety, what comes to mind is actually the numerous so-called accidents. But let us define a spade as a spade. We don't call it an accident. We call it a road crash. And I think that should be, we should be conscious of that. Because when we talk about accidents, it is unexpected, unplanned, And most often than not, palusot ng mga tao na ay hindi po sinadya. At nakakalusot tuloy sa kanilang obligasyon not only to prevent one, but also as a matter of consequence doon sa sa mga tao na naperwisyo nila because of the road crash. That's why we call it aptly a road crash, because accidents could have been foreseeable or preventable, and that's precisely why those who would be responsible for these accidents should be answerable for the acts. No? As you can see, 1.25 million people die due to road crashes every year. No? So we just don't call it accidents because these are preventable incidents, by the way. And if we look at the records of the LTFRB insofar as road crashes are concerned, based on the cases that have been adjudicated before the board, both in the national and even in the regional offices, ito po yung allocation ng mga categories of modes of public transport. No? We have buses, we have jeepney, shuttle bus, taxi, trucks for hire, and even UV Express and PhilCab. So the biggest share insofar as accidents or road crashes are concerned would be the buses, followed by the jeepneys. And because of that, we have to look at road safety issues on 4 levels insofar as LTFRB is concerned. So first, we look at policy, and second, enforcement. I mentioned earlier about public utility vehicles involved in road crashes, and therefore we would issue show cause order for us to determine accountability insofar as public utility vehicle operators are concerned. Engineering is also what is required, and that's the reason why I think it was well elaborated by Yusek Carvajal insofar as putting in place infrastructure on the road so that it would be more safe to take the road, whether as a pedestrian, a commuter, a driver, or motorists. And on the part of the LTFRB, we have put in place and institutionalized the education component insofar as public utility vehicles are concerned, more principally addressed to our public utility drivers. The policy, as mentioned, we have to put premium on road safety, not only based on the competence of the driver, but also insofar as the vehicle is concerned. Marami po tayong naririnig na mga road crashes that are what we call engine or vehicle defect. And that is what we're addressing as well, no? Under our POV modernization program. Now, insofar as so there is another data that we have gathered that among the leading causes of death is actually transport road crashes, both in 2019 and also even as late as February of 2021. And this is from the Philippine Statistics Authority. And the common victims of these road crashes are the working class, 18 to 34 and 35 to 51. This source is coming from the Land Transportation Office. Also, when we talk about death arising from road crashes, 16% comes from four-wheel vehicle. Cyclists account for 2% of death due to road crashes. And as mentioned, the biggest actually comes from the largest share insofar as numbers of death arising from road crashes are due to motorcycle related road crashes. we should also put emphasis on pedestrians, whether they cross the street or simply walking along sidewalks. And that's the reason why we have to push also access and access on the part of the road, on the part of policymakers to put more infrastructure for the safety of our pedestrians. Insofar as LTFRB is concerned, as we have made mention earlier, as early as less than a year after we assumed office, we institutionalized the Drivers Academy program. There were already individual initiatives by some of the regional directors prior to July 2016, but when we assumed office, we thought it appropriate and fitting that we need to institutionalize this program all throughout the country and put in place modules that would address the issue of road safety on the road, particularly insofar as competence of the PUV drivers are concerned. Ang nangyayari kasi, except for the bus companies and perhaps some of the fleet-managed PUJ transport cooperative, where they can oh, I'm sorry. I lost it. Where they have, if I may continue, except for large bus companies or fleet-managed transport cooperative, where they have the capacity to educate their drivers, most of the PUV drivers would need retooling, education, as well as refresher course on their obligation when they take the steering wheel of their vehicle on the road. No? Some of these modules, and we have put in place a module, if I may acknowledge the contribution made by the top leading, universities in the Philippines, namely Ateneo de Manila University, De La Salle University, and University of the Philippines, for contributing to the training modules that we have put in place for our Drivers Academy program. So for Module 1, we have to remind our PUV drivers of the LTFRB policy. Most of these policies are downloaded to the operators, but the operators at some point or even frequently would not educate their drivers insofar as the policy of the LTFRB is concerned, insofar as road safety is concerned. So we have Module 2 as well on safety first, meaning we have to remind our drivers to be more defensive in their driving. Ang lumalabas kasi, because of the current situation now, which we're trying to address, na humaharurot at humaharurot yung mga public utility vehicles para makakahanap ng mga pasahero. Mahirap naman kung ganun yung mindset ng mga drivers, ano. Yung third naman, nakikita natin ito paminsan-minsan, na that's why we need to address the emotional well-being of our PUV drivers. No? So we have a module on road rage and anger management, no? Para yung mga nakikita nating away sa daan, especially among PUV drivers, would be avoided. Traffic signs are also traffic signs and road pavements are also being discussed in the module. And Fifth is good grooming. Since the launch of this Drivers Academy program in August of 2017 until December of 2020, we already have a total of 289,000 participants. We, unfortunately, during the period of the pandemic, although we continue with the program, the number of drivers were limited because they were done online. But for 2021, we also have introduced the second module that we have for the Drivers Academy program, which includes the transport security protocol to distinguish possible threat against lives and properties. It would also be good for us to educate the pedestrians as well in terms of being aware of what we call the transitional spaces that we move around, and for our commuters who are actually inside public utility vehicles. We also would like to inculcate Filipino culture and values insofar as the driving behaviors of the PUV drivers are concerned. Yung matulungin, may malasakit in terms of relating to their pasahero, yung mga commuters po. Also, it might be good to remind also the vehicle dynamics, no? Yung mga traditional PUVs, and to identify driver's action to environmental factor. This would also be addressed later on insofar as I have made mention about the largest non-infra project of this administration, which is the PUV modernization program. We also have introduced a module for eco-driving, so that not only are we trying to address road safety, but we are also addressing environmental concerns, so that we would be efficient, or at least fuel efficient in our driving technique. Also, we have introduced basic life support, no? Lalong-lalo na during road crashes, even before our emergency medical personnel would be able to rescue and get to the scene of these incidents, the drivers themselves will be able to administer basic life support skills on wounded passengers, perhaps, or other persons. PUV passengers' rights, fines and penalties as well, no? Because we need to understand that yung mga drivers at sa mga PUV operators have no obligation to their commuters. Drivers' healthy, safety, and rights is also very important, so that their physical, psychological, and emotional well-being are maintained, and in fact should be determined even before they would take the public utility vehicle on the road. Now, as mentioned, the biggest program that we have is the PUV modernization program, in order to modernize our current state of public transport system. As you may see, our public transport system now is, especially on some modes of public transport like PUJ, UV Express, PhilCab, these are based on what you call the boundary system, kung saan yung driver is what we call a de facto operator. They take the vehicle, they take the PUV at whatever time they might want, and run the vehicle all throughout the day, looking for passengers so that they would be able to earn money. However, there is not much supervision on the part of the operator insofar as the current system of the boundaries of the what we call boundary system is concerned, and that is what the PUVMP is trying to address. The objective being that the drivers now will not be on a boundary system for which they are competing with other drivers for passengers on the road, but rather they're being paid salaries as well as benefits. There are fixed working hours for them insofar as operating the vehicle is concerned, based on the fleet management system that is put in place by the PUV operator. So hindi na po sila tatakbo ng mga 14, 15, 16 hours on the road just to earn enough money to pay for the boundary or the rent of the vehicle to the operator and take home some money for their family. But now they're more secured and more comfortable insofar as having to work on a fixed operating hour with benefit. The other program that is currently being implemented is the service contracting program. We all know that during this time of pandemic, there is reduced capacity in all modes of public transport. 50% lang po ang pwedeng sumakay sa kahit na anong klaseng pampublikong sasakyan. No? Like for example, in Metro Manila, which is currently under GCQ with heightened restriction. That being the case, consequently, because financial viability of the PUVs are based on the passenger capacity, they have less likely to earn than before the pandemic came in. Now, the service contracting program is to address the gap, the income gap of the drivers during the pandemic. The program includes key performance index that involves commuter feedback, positive feedback, and higher incentive bonus. Ang nangyayari po rito, we have two types of service contracting program. The one is a net service contracting kung saan the drivers and operators would keep what you call the fare box, yung pamasahe na kukuha nila sa pasahero, but on top of that, they would still be paid by government under this program on a per kilometer basis. So, menos man o marami ang pasahero, they will still be paid on a per kilometer basis to cover the shortfall on their expected income for the day. There is also the gross version of the service contracting program kung saan yung buong operation ng PUV is paid for, 100% paid for by the government. Ang tawag po natin dito, at nakikita na po natin ito sa lansangan, not only in Metro Manila, but all throughout the country, yung tinatawag po nating libreng sakay. Minandato po ito ni Secretary Art Tugade na mabibigyan ng libreng sakay. If you may recall, during the time of the pandemic and the time of limited public transport, there was a program by DOTR which provides libreng sakay to healthcare workers. Now, that idea came about during that time when essential workers would need public transport, particularly health workers. And it gave the idea that under the service contracting program, we would continue the same as in fact, it is now incorporated under the Libreng Sakay program, where healthcare workers are provided free. Ibig sabihin po, libre yung pamasahe doon sa mga rota kung saan tumatakbo itong mga tinatawag na libreng sakay public utility vehicles. Ngayon, we expanded this not only to the healthcare workers, but also to the what we call allowed persons outside of residence or APOR. Ibig sabihin, pati yung mga nagtatrabaho sa essential services may also avail of this libreng sakay under the service contracting program. I would just like to take note that the service contracting program was envisioned to help the critically impacted public transport sector, particularly the PUJ drivers, and drivers of other modes of public transport. But nevertheless, we saw the opportunity na hindi lang po sila ang magbabenepisyo, pati na rin po yung mga mananakay. Kaya po, minabuti ni Secretary Tugade na paigtingin pa at palawakin yung tinatawag nating gross version of the libreng sakay na kung saan libre po yung pamasahe. So with that, that is how we are addressing insofar as road safety is concerned, kasi nakakatulong na sa mga ganitong klaseng programa, we are trying to avoid the on-street competition among drivers and operators. Thank you very much.
Thank you, Attorney Delgra. Providing a dependable public land transportation services requires implementation of programs based on commuting needs of the Filipino people. Through this year's webinar entitled A Decade of Success Ahead, or Advancing Health Evidence-Assisted Decisions, Health Policy and Systems Research, we will be able to determine and create evidence-based and data-driven policies and programs on road safety. Dr. HERBOSA and Professor Jinky Leilani Lu will be presenting some results of their comprehensive study on epidemiology of road crash injuries and constructing a road safety index. The full results of their study will be uploaded on YouTube and is about 30 minutes each for the 4 major databases, including the policy recommendations. I have introduced Dr. HERBOSA earlier. So for Dr. Jinky Leilani Lu, she is a research professor at the National Institutes of Health, UP Manila. She has authored 2 books. First, Gender, Information Technology and Health, which won the National Academy of Science and Technology Book Award in 2010 and was reprinted by the University of Hawaii Press in 2007, and The Basics of Occupational Health and Safety, Guidebook for Practitioners and Industries, published by the UP Press. She also contributed chapters in books that are Thomson Reuters recognized publishers. She has produced 50 journal articles, all of which are Science Citation Index, thus earning her the title of University Scientist from 2007 to the present. She is currently the Secretary and Next Chair of the International Commission on Occupational Health. Dr. Lu is a staunch advocate, both as an engaged academic and scientist, in promoting well-being among vulnerable populations such as road users.
A great morning to all of you. It is a great pleasure on my part to share with you the results of our study on road safety in the Philippines. This program has 2 component projects. I am the project leader, and Professor Jinky Lu is one of our project leaders. Advancing Health Through Evidence-Assisted Decisions with Health Policy and Systems Research, or the HERBOSA program, was funded by the Department of Science and Technology, Philippine Council for Health Research and Development, and the Department of Health. This research program has 2 component projects and is aimed at investigating road safety in the Philippines, eventually developing a road safety index, RSI. RSI is composed of variables or components that can be predictive of the road safety status of any place. By improving these components, the road safety status can also be improved. There are 5 pillars to road safety, which is laid out by the World Health Organization: road safety management capacity, safer roads and transport networks, safer vehicles and mobility, safe road behaviors, and post-crash response. Our study covers 4 databases: the Integrated Surgical Information System, or ISIS, of the Department of Surgery of the Philippine General Hospital, which began its electronic records in 2008. Second, the Online National Electronic Injury Surveillance System, or ONIS database of the Department of Health, which started its dry run in 2009 and formally started uploading data from various hospitals nationwide in 2010. Although out of more than 2,000 hospitals licensed in the Philippines, about only 304 on the average over the years have been uploading their injury data to ONIS, and their injury data contains transport and vehicular crashes. 3. Advancing Health Through Evidence-Assisted Decision, or the AHEAD database, covering 8 major tertiary hospitals nationwide, where our patients' charts and medical records were retrieved manually and encoded by our research assistants. 4. The Metro Manila Accident Recording and Analysis System, or MARAS, which is a road crash reporting system created by the MMDA and the Philippine National Police, and we will include also data from the DPWH datasets. For this webinar on post-crash response, we will present only the AHEAD and the MARAS datasets due to our time constraints. We have a total of 40,286 road crash patient data retrieved and encoded manually by our 40 research assistants in all the deployed hospitals. The most number of charts encoded were from Davao Regional Medical Center in Tagum at 18,333, followed by the Philippine General Hospital at 7,483, and the East Avenue Medical Center at 6,790. The other hospitals included in the project are Jose Reyes Memorial Medical Center in Manila, the Southern Philippines Medical Center in Davao City, the Talisay District Hospital, and Vicente Soto Medical Center in Cebu. The mean age of road crash patients in hospitals is 31.6 years, with a standard deviation of 16.67. The average distribution is bimodal, initially peaking for a 5-year-old and then the highest peak at 22 years old. 59% of the reported victim types is composed of drivers. Pedestrians occupy a larger proportion of 22% of those injured. The least are the passengers at 19%. 81% of the reported vehicle types for drivers and passengers were brought to participating hospitals were involved in motorcycle crashes. This was followed by tricycle and pedicab or bicycle crashes, both at 5%, and cars constitute only 3% of the total reported. A huge part of the database is still missing for the risk factors. The non-use of seatbelt is the most common reported risk factor, followed by alcohol intake, then the non-use of helmets. The HEAD database on body parts injured showed a 41% with multiple injuries, 41% with head and neck injuries, 23% with the face, 18% in the chest, 10% in the abdomen, and 53% on extremities, and 74% had other external injuries. 50.4% of patients reported to have suffered only one body part injured. 24% have suffered two body parts injured, and 7% suffered three body parts injured. Less than 2% suffered 4 or more body parts injured. Now let us go to our inferential statistics. Deaths are associated with the victim type, and the number of deaths for drivers are significantly higher than expected. On the other hand, what are the risk factors associated with road crash? Alcohol intake, drug intake, and fatigue are significantly associated with deaths. Alcohol intake has a Phi coefficient of 0.217, suggesting a positive association with deaths. Drug intake has a Phi coefficient of 0.026. While small, due to the small sample size, it is still significant enough to reveal a positive association with deaths. Fatigue has a Phi coefficient of 0.158, suggesting a positive association with deaths. Also, using regression analysis, alcohol intake increases the odds ratio of dying by 7.6 times. Deaths are also associated with body injuries. The Phi coefficient for head and neck, face, chest, abdomen, and multiple injuries suggest a significant positive association with deaths. This means that there are more deaths for those who suffered from injuries to the neck, to the face, and the abdomen. The Phi coefficient for extremity and external injuries is negative. This suggests that there are more who are discharged among those who have suffered from merely external injuries. Specifically, using regression analysis, face injury increases the odds ratio of dying by 5.41 times. Chest injury increases the odds ratio of dying by 2.75 times. Abdominal injury increases the odds ratio of dying by 6.7 times. Deaths are also associated with the number of body parts injured. Analyzing adjusted residuals, it can be seen that there are significantly larger than expected number of deaths for 2 injured body parts to 5 injured body parts. The Glasgow Coma Score is significantly associated with death. The largest deviation from expected deaths belong to severe brain injury. The number of deaths in moderate brain injury is also significantly large. Recovery is significantly large for minimal brain injury and no brain injury. Specifically, using regression analysis, a 1-point increase in GCS on the average decreases the odds ratio of dying by a factor of 0.731. On the length of hospitalization, there is a significant association between length of hospital stay and vehicle types. For both the driver and the passenger victim and pedestrian victims, the longest length of stay belongs to those who are victims of truck crashes. There is another interesting analysis that came out of this project. It is the trauma scoring system. About 30 years ago, Dr. Howard Champion, a trauma surgeon, and his colleagues introduced the RTS, or the Revised Trauma Score, which has been extensively used to assess outcome or prognosis in trauma patients and road crash injuries. There are 3 parameters in the RTS as shown in the table, which are the Glasgow Coma Scale, the systolic blood pressure, and the respiratory rate, all of which can be assessed easily and manually. These variables together are known to correlate statistically with survival and mortality. The higher RTS is associated with a better chance of survival, while the lower indicates a poorer prognosis. We also looked at the other scoring systems and found one used in African continent. As a variant, we have the Kampala Trauma Scoring, or the KTS. It was developed in Kampala, Uganda, considering the resource limitations of hospital settings in Africa. It considers 5 parameters: the age, the systolic blood pressure, the respiratory rate, the neurologic status, and severity of injury. Again, the higher KTS score, the better the prognosis. Unlike the RTS, it is not weighted and it is merely the sum total of all parameters. Using the AHEAD data set, we came up with a combination and a new scoring system unique to our patients seen in the Philippines. We call the Proposed Trauma Scoring System, or PTSS. We have no time to discuss with you the statistical derivation of our PTSS, but suffice to say that this is based on the principles of all the current scoring systems, the RTS, the KTS, and even the Revised Trauma Injury Severity Score, or TRIS. And suffice to say also that the logistic regression to come up with the equation and coefficients per parameter of the PTSS was based on the 4,000 plus road crash patients in the largest hospitals in the Philippines for the past 10 years. Now the question is, how good is our model for trauma scoring, which is the best performing in terms of classifying who is going to die and who is going to recover? In this analysis, the ROC-AUC, or Receiver Operating Characteristic Area Under the Curve analysis, was used to evaluate and compare how good the models are in predicting patient recovery. Visual analysis of the graph shows that the red line, which is our proposed scoring system, has a higher AUC than the gold standard's RTS, the blue line. Thus, for Filipino patients, the better scoring system and classifier is our proposed trauma scoring system. Now we go on to our conclusion. The significant factors in road crashes we found in our study are: the victims are very young. The victims are people in their prime working age. The motorcycles comprise the largest vehicle type involved in road crashes. Alcohol increases the risk of death and injury. Those who died and had longer hospital stay were those with multiple body part injuries, lower Glasgow Coma scores, and those with injury to the face, head, chest, and abdomen. Our proposed trauma scoring system is superior and has a better classification rate for Filipino road crash patients than the gold standard RTS. Thank you very much. I now turn over this presentation to Professor Jinky Lu.
Thank you so much, Dr. Herbosa. Now I will proceed to discuss the Geographic Information System, or GIS, showing the dangerous roads in the country.
Where are the most dangerous roads located? These three maps show how data in the MARAS dataset is distributed throughout the NCR. The leftmost map is the actual cases recorded per city. Here, Quezon City records the highest number at almost 20,000 counts. The next highest are Manila, Pasig, and Makati, respectively. The map in the middle are the number of cases recorded adjusted to the city's population. Makati and San Juan here rank the highest. Makati clocked 11,202 cases per 100,000 population, while for San Juan, it is 12,207 cases per 100,000 population. This means that these areas, more than 1 every 10 persons are involved in any sort of road crash incident. The rightmost map is the number of cases adjusted by square kilometer. The top three cities are Makati, Mandaluyong, and San Juan. Makati has 2,385 road crashes per square kilometer, and Mandaluyong has 2,762 crashes per square kilometer. At this point, I would like to share with you as well the DPWH black spots. MARAS data is only for Metro Manila. Hence, we also ask data from the DPWH for road crash reports across the country. It is called black spot because it shows areas where road crashes mostly occur. First, I will present Metro Manila for road crash analysis. For road crash data, we have a total of 8,933 observations from DPWH containing locations of road crash incidents. The data provided are road crashes that occurred from January 1, 2016 to December 31, 2018. The data set has a variable for road crash severity, which categorizes the data into fatal crashes and serious injury crashes only. No damage to property crashes was included in the data set. 94.7% or 8,461 points are categorized as serious injury, and 5.3% or 472 are categorized as fatal. 463 observations were provided, on the other hand, by DPWH containing locations of road crash incidents in Region 7 or the Cebu area. The data provided are road crashes that occurred only in 2018. In Region 7 or the Cebu area, 92.65% or 429 points are categorized as serious injury, while 7.35% or 34 are categorized as fatal. The red dots in the map are the fatal crashes, while the green dots are the serious injury crashes. There are only 29 observations provided by DPWH for locations of road crash incidents in Region 11 or the Davao area for 2018. Hence, it was not feasible for analysis. Now we show you the DPWH black spots. It is called black spot because these are the areas where road crashes cluster. Cluster of crashes with high number of victims lie around the lower part of Quezon City, around San Juan, Mandaluyong, Marikina, Pasig, and Taguig. These are the dangerous roads in Metro Manila. Clusters of crashes with low number of victim counts lie around the northwest portion of Quezon City to Valenzuela, as well as Manila City. In Region 7, high cluster hotspots are detected in the island of Bohol, while the island of Cebu has no high cluster hotspots. Road crashes in the island of Cebu are generally lower than that of the island of Bohol, especially in the lower part. At this point, I would also like to share the analysis from the dataset given by the Cebu City Police Office. 6,955 blatter reports were provided by the police office. Of these, 4,524 were road crash incidents. The earliest observation is 2017 and the latest is 2020. More than 95%, however, are from 2019 and 2020. Dropping observations with missing coordinates, among others, from the 4,254 reports, only 1,932 observations were considered for point pattern analysis. In the map, as you can see, the green dots represent blotter reports that are crimes against property, while the red dots are crimes against persons. For this discussion, crimes against property and crimes against persons pertain only to road crash incidents. 1,500 blotters, or 77.63%, were categorized as crimes against property. Majority of these cases are within the poblacion areas and the national highway. The immediate areas around the Osmeña Circle contained more than 100 crimes against property. Most of the cases are also happening in the intersections. The intersections of V. Rama and B. Rodriguez and the intersections to the national highway are included. In fact, these areas alone constitute around 50% of all road crash incidents. 432 reports, or 22.37%, were categorized as crimes against persons, meaning the person was killed or was injured as a result of the road crash incident. While crimes against persons also cluster in the national highway, there seems to be less clustering around the Osmeña Circle for crimes against persons. Instead, crimes against persons are clustered around the intersection of V. Rama Avenue and M. Velez Duterte. There were also clusters of crimes against persons around the intersection of Katipunan and Salvador Streets, which have notably lesser number of crimes against property. Victim status is a variable data set with categories, namely deceased, hospitalized, injured, killed, released, under custody, unharmed, and wounded. For this analysis, categories are lumped into four. We have the unharmed, the injured, the deceased, and others. The red dots represent areas that are hotspots with high severity of crashes. The blue dots are hotspots of lower crash severity. Space-time interaction is found for all criteria of closeness in time and closeness in space. The data shows that in the areas included, if a road crash occurs, one can find another road crash within 1.11 kilometers, 111 meters, and 11.1 meters of the area within 30 days, 7 days, or 3 days. Hence, there is proximity of space and time in the occurrence of road crash. Road crash, in other words, happens in every 11.1 meters every 3 days at a minimum, or kada isang kanto sa bawat ikatlong araw ay may sakuna sa daan o may road crash. As discussed earlier, we have 4 data sets. I have only discussed the MARAS data set here, but I would like to share few summary statistics on number of road crash incidents across databases, as well as the number of injured and killed. In the ONAS, there is a total of 296,700 vehicular crash patients from 2010 to 2019. This means that there is an annual average of 28,974 road crash patients brought to the hospitals over the span of 10 years. In the MARAS, there is a total of 1.35 million crash incidents from 2005 to 2020. This is an average of about 78,000 road crash incidents in Metro Manila alone. In the PGHICs, there is a total of 4,979 road crash patients from 2008 to 2017. This is an average of 497 road crash patients every year brought to Philippine General Hospital. In the head hospitals, where we have the 8 major tertiary hospitals all over the country, there is a total of 40,286 road crash hospital patient data gathered from 2009 to 2020. This is an average of about 4,000 road crash patients per year. For injuries across all databases, the total number of injured persons across data sets is 623,314. This has economic impact affecting the individual, the household, as well as the country as a whole. On the other hand, across all data sets, the total number of killed persons from road crash is 14,352. It is a large number of people needlessly dying from a road crash incident that could have been prevented. Before I end, we would like to say that we need to harmonize the reporting and surveillance system for road crash and include essential data across institutions and across hospitals. This can be an output as a result of this webinar series. There are many more recommendations we are proposing based on the results of this study. Hence, decisions become assisted or supported by evidence, which AHEAD stands for.
Lastly, I would like you to bring home this message. Road crashes do not happen. They are caused.
With that, the presentation has ended. Thank you. Maraming salamat. Mabuhay ang Pilipino.
Thank you, Dr. Herbosa and Dr. Lu, for that very informative talk on the epidemiology of road crash injury among patients in major hospitals in the country, as well as the data from other agencies. Remember, the victims of road crashes are very young, and those in their prime working age. Surely, road safety is everyone's responsibility and should be everybody's priority.
Kung pagod at inaantok na, magpahinga. If you are tired, take a rest. As hardworking people, we tend to work for long hours even if our body gives a signal that we need to take a rest. And see this video.
Hello pa.
O kuya, pauwi ka na?
Opo pa. Patapos na kami dito sa trabaho.
Madaming tawag? May masungit?
Madami pa eh.
Tiyagain mo lang anak. Mag-break ka ha. Matulog ng maigi pag uwi.
Naku pa, mukhang ikaw kailangan magpahinga. Kapag hindi kaya, mag-break muna ha.
Nahuli mo ako ah. O siya, ingat ka pa uwi anak.
Kayo rin po, magpahinga. Bye-bye.
Bye-bye.
May naiwan ka, boss?
Wala, pero antok pa. Recharge muna para iwas disgrasya.
Sige, boss. Recharge muna. Kung pagod at inaantok na, magpahinga para iwas disgrasya.
Indeed, driving tired or fatigued can lead to fatalities on the road. But if we take precaution, we can prevent road crashes. Slow down and take a rest is our message here. Slow down on the roads and protect our passengers and pedestrians. Slow down and do not overspeed. Slow down and share the road space. And slow down and practice courtesy on the road.
We sometimes wonder and ponder where road crashes mostly occur. Our next speaker is the current Assistant Director of the Bureau of Quality and Safety of the Department of Public Works and Highways since 2016. Assistant Director Jonathan L. Araulio obtained his engineering degree from Mapua Institute of Technology. He pursued a master's degree on urban and regional planning in 2011 with specialization on transportation systems at the School of Urban and Regional Planning, University of the Philippines, Diliman. With more than 27 years of experience in the field of traffic engineering and management, transport planning, and road safety, and strong technical background on road safety processes and traffic control systems, He provided exceptional contributions to the development of various traffic and road safety standards in DPWH. Engineer Jonathan L. Araulio.
Good morning, everyone. On behalf of our secretary, thank you very much for inviting DPWH. A while ago po, our undersecretary presented the general framework for road safety strategy in DPWH. And for this particular session, we will try to share with you the DPWH strategy in providing engineering solutions for black spots or yung mga accident-prone areas. Next slide, please. So the strategy intended for the treatment of black spots is called the Accident Reduction Program. And to set the general context for the discussion, it would be simpler if we try to describe the process within the context of the overall project development cycle. So the project preparation stage for accident reduction program is comprised of three key steps, namely identification of hazardous locations, second, investigation of hazardous location, and lastly, the formulation of candidate projects. At the end of this stage, we expect concept plans for infrastructure improvements of hazardous locations being generated, evaluated, and approved for funding and implementation. So let's start off with step number 1. Next slide, please. First, we need to identify what is a black spot. The DPWH Accident Black Spot Investigation Handbook uses the term black spot to refer to all types of hazardous locations. A black spot location could either be an intersection, a road section, or even small areas with higher than average road crash rate. Next slide. So what is the relevance of road crash data in identifying black spots? It is important to note that the identification of black spots relies on historical road crash records. Once hazardous locations are identified, crash data analysis will help us in identifying the root cause of the problem. It also helps us to establish the trend or pattern of crashes. Lastly, the reliability of the information will also guarantee the efficiency of implementing the road crash reduction and prevention treatment program. Next slide. How do we identify black spots? Black spots can be identified from different sources. Ideally, black spots are identified through statistical analysis of road crash records. Before, the primary reference of DPWH for road crash data for national roads is the TARAS, or the Traffic Accident Recording and Analysis System. However, the operation of TARAS in DPWH was terminated in 2013. And in the absence of TARAS, as a temporary process, DPWH is currently sourcing its crash data requirements from the PNP e-blotter system. Now, aside from the PNP, black spots can also be identified from other sources such as our regional and district engineering offices and also the local government units who are more familiar with the safety performance of road sections within their respective jurisdictions. Lately, there are efforts to establish a single platform of road crash database in the Philippines, which is being spearheaded by the Department of Transportation. We call this platform the driver system, or the data for incident visualization, evaluation, and reporting system. a web-based and open source system for geospatially recording and analyzing road crashes. Once fully institutionalized, we believe that the driver system can be a reliable source for identifying black spots. Next slide. So, what are the criteria being used to identify black spots? Here in the Philippines, the following definition is being adopted, consistent with the DPWH Accident Black Spot Investigation Handbook 2004 edition. Generally, a location can be considered as a black spot if an average of 3 major road crashes per year is occurring based on 2 to 3 years of historical crash records. Please note that the criteria is focused on major road crashes or those which resulted to fatal or serious injuries, because we believe that this type of crashes are regarded as having the greatest impact on the community, both in terms of economic and social cost. Now, at the end of the process, we have a list of black spots that will have to be considered as candidates for treatment action. The list is generally being updated annually. Every time an updated annual crash data is being provided to us by the Philippine National Police. Next slide. Now, this slide shows the updated summary of identified black spots on national roads based on the CY 2018 annual crash data. Based on this update, about 2,700 black spots were extracted, and based on this list, sites will be selected and will be subjected for a detailed investigation. Next slide, please. So going to the next step, how do we investigate black spots? Based on the updated list of black spots, DPWH selects locations that will be subjected to investigation. As a general rule, priority is being given to sites where more people are being killed or seriously injured. This means giving priority to investigating locations with the highest average of major road crashes per year. The objective of investigating black spots is to identify crash patterns or trends, as well as identifying potential contributory factors to the trend of crashes in the area. The objective, the investigation of hazardous locations requires a systematic and logical step-by-step approach and an understanding of the nature of road crashes. So let me highlight this basic guiding principle. Next slide, please. The DPWH road safety processes are anchored on the principle of breaking the accident chain. Studies have shown that the 3 contributory factors in motor vehicle crashes are the following: human factors, which are involved in around 95% of crashes; road environment factors, 28%; vehicle factors, around 8%. Now, these 3 factors often combine in a chain of events that result in the occurrence of a road crash. Now, ideally, we would say that in order to significantly address the issue, we should focus on the major factor, which is related to human behavior. But this is usually the hardest and the most difficult area to resolve. And so, rather than focusing on the human factors, might as well focus the attention on reducing the effects of the other factors. And this is why the reason the DPWH is trying to focus on the road environment factors. As you may have noticed from the diagram, about 25% of the human factors that contribute to road crashes are interacting with the road environment. We believe that by addressing the road environment issues through road safety processes like black spot investigation, this would allow us to break a link in the chain of events that leads to crashes, and somehow this would reduce the rate of major crashes in the area. Next slide, please. Going on with the second step, to be able to effectively analyze data, we need to translate the information into alternative formats. To assist in easily understanding the crash patterns, crash data recording and reports uses the TAD codes, or the Traffic Accident Description Codes. This slide shows all the TAD codes used in accident investigation. A TAD code is basically a number that is assigned to identify a particular crash type. This method of coding and classifying road crashes facilitates the crash data analysis process. Next slide. Another data presentation format is the collision diagram. A collision diagram is a diagrammatic representation of the crashes that have occurred at an intersection or along a road section, which allows us to visualize the concentration or clustering of a particular crash pattern in the area. Usually, the collision diagrams can be extracted from the narrative portion of the PNP e-blotter system. Next slide, please. Another data presentation format is the crash factor matrix. A crash factor matrix can be used to present data in a tabular format. This particular sorting helps to reveal common factors. Now, this slide shows a sample crash factor matrix for a specific black spot in Region 1. A review of this matrix reveals that the predominant crash pattern in the area are same direction type of crashes, which could either be rear end or side swipe. Also, you will notice that majority of these major crashes is happening during nighttime, and that predominantly motorcycles and tricycles are the type of vehicles usually being involved. Next slide, please. Having identified the pattern, the next step is to diagnose and analyze the crash data in more details by inspecting the site. The goal of this activity is to identify contributory factors that somehow can potentially influence the occurrence or severity of crashes. Going back to our previous example, you can see that several potential contributory factors were identified for a particular black spot in Region 1. The factors ranges from road alignments, intersection configurations, delineations, and some notable roadside frictions. Now, these observations will now be used to develop the treatment proposals. Now, next slide. Let us try to expound on the third and last step. It is rare that the investigation will point to a single cause of crashes in a particular location. What's important is that there are various types of countermeasures that are applicable for certain type of crashes. For example, this slide shows some of the typical treatment options for addressing cross-type crashes at intersections. Knowing the range of treatment for certain type of crashes allows you to identify all the possible treatment options. From there, we can come up with the overall treatment proposal comprising of a package of road safety measures that are expected to achieve the greatest reduction in the frequency of crashes in the area. Next slide, please. In order to develop a treatment proposal that is to be effective, knowledge of the likely reduction in crash rates for different types is required. This slide shows accident reduction factors for a range of standard treatment types. The slide also shows the typical treatment life for each options. Next slide, please. The potential projects that passes through the screening are now subjected to project evaluation. The goal of project evaluation is to find the project that provides the most cost-effective way of allocating the investment. The assessment is done using the cost-benefit analysis to come up with an indicator reflecting the overall economic merit. Next slide, please. Going back to our sample black spot in Region 1, this is now the formulated set of remedial countermeasures. The program basically cost about 900,000 with a computed BCR of 29. It is being projected that the implementation of these measures will reduce the rate of fatal and serious injury crashes in the area by 25% in 10 years. Lastly, next slide po. Having presented all this, we just want to emphasize that making small changes to the design and construction of the road and the way traffic is managed can significantly reduce the rate of crashes in a particular location. We believe that it only takes one of the links to be broken to reduce the fatal and serious injury crashes. This is the essence of the black spot treatment program. The bigger challenge, though, comes not from the identification, but to ensure that the formulated projects are funded and implemented. The DPWH management, under the leadership of our Secretary Mark Villar, realizes that road safety is a primordial concern, and so the mechanisms are being laid out to ensure that all road safety programs are well integrated in every road project. In the coming years, we will be seeing more road safety programs consisting of both preventive and reactive approaches being implemented. This is our share under the Philippine Road Safety Action Plan to build safer roads and to make our existing national road network safer to use. Maraming salamat po and good morning.
Thank you, Assistant Director Araulio, for sharing what DPWH is doing for black spot treatment in the country to prevent road crashes. Now, the MMDA, or the Metropolitan Manila Development Authority, is mandated to creating and implementing an integrated development plan that will promote quality of life for the Metro Manilans. For a brief report on the transport and traffic management and enforcement in Metro Manila, we have the MMDA.
Chairman Benjamin C. Abalos, head of MMDA, is a professor and lecturer at the University of the Philippines, National College of Public Administration and Governance, Development Academy of the Philippines, and Local Government Academy. To represent Chairman Abalos, we have Mr. Antonio B. Pagulayan Jr., with over 22 years of public service and undergraduate and master's degree in public administration. Mr. Pagulayan currently serves as the Traffic Operations Officer in MMDA. He's a road safety practitioner and an avid advocate.
Thank you very much, Ms. Lu, and thank you very much, Dr. Jinky Lu. Good morning, everyone. On behalf of our MMDA Chairman Benhar Abalos, I'm Mr. Pagulayan of the Traffic Discipline Office, and I'm very much honored to present to you our traffic and transport management and enforcement initiatives and the review of our road crash data in Metro Manila. Next, please. Next slide, please. Now, starting with our engineering initiatives, let me just present to you some of the initiatives of MMDA because we know for a fact that the traffic management here in Metro Manila is largely a interagency affair. So for this purpose, foremost of our road safety initiative on traffic and transport management is the upgrading of our traffic signal system, which involves the migration of old system to the new traffic system covering 458 intersections, capable of handling future intelligent transport system functions. We are now on the phase 5 of the project, which covers 50 warranted intersections and the integration to the existing traffic signal control system, including the installation of LED lightings. This also includes the installation of fiber optic communication system for the traffic signalization to cover 205 signalized intersections and 100 CCTV sites. Next slide, please. Sooner or later, our physically challenged individuals, particularly the blind, will benefit from our proposal to install audible or acoustic traffic signals because early this year, our Traffic Engineering Center has identified 20 signalized warranted intersections for the installation of such equipment. The selection of these 20 intersections is based on the data of persons with disabilities of LGUs with persons with disability affairs officers submitted to our office. Next slide, please. If there is one infrastructure project that we can be proud of, I think it is the construction of footbridges. For several years now, MMDA has been promoting pedestrian safety by constructing footbridges in strategic locations in Metro Manila. Basically, the purpose of these footbridges is to ensure that pedestrians do not come in contact with vehicles, thus preventing pedestrian vehicle collisions. As of December 2020, 5 completed pedestrian footbridges are added to the existing 73 footbridges, serving an average of about 2.6 million pedestrians daily. Next, please. Other engineering, next slide, please. Other engineering interventions of MMDA include the construction or installation of wire mesh, railings, geometric improvements, installation of traffic signages, and of course, our sidewalk improvements. Next, please. Let me now deal with our public information efforts and on road safety. Next, please. Inspired by the Road Safety Community Park of Singapore, the MMDA Children's Road Safety Park is located on a 4,600 square meter lot located in Atletico Street corner Quirino Avenue in the city of Manila. This was built to provide a venue for children where they can learn and observe traffic rules and regulations, realize its importance, and have a deeper understanding of road safety in a controlled setting. As part of the tour activity within the Children's Road Safety Park, our tour guides spend some time in showcasing the many traffic-related infrastructures to our road users, particularly the school children, such as the mini footbridges, pedestrian tunnels, waiting sheds, and other road safety facilities. In 2019, we are proud to inform everyone that the CRSP, or the Children's Road Safety Park, was awarded was one of the best practices in government by the Development Academy of the Philippines. Next, please. Next slide, please. In 2004, by virtue of the MMDA Council Resolution number 0407, series of 2007, the Traffic Academy was established to strengthen and improve the traffic education not only to our traffic enforcers of MMDA and local traffic personnel, but to the motorists and the riding public as well. Since then, we have trained thousands of traffic personnel on traffic enforcement and management, road safety, crash investigation, incident or traffic incident management, road emergency response, including road safety. MMDA has also installed light emitting diodes or the advisory boards in strategic areas in Metro Manila, particularly EDSA. The LED board provides real traffic situation, enabling motorists to have informed choices of the best route to take and to do away with congestion. These message boards also provide motorists other relevant information like weather reports, events, road crash locations, and road safety tips. Next, please. Now, dealing with our enforcement and policy measures. Next, please. Next slide, please. Okay. The WHO report in 2004, or the Road Traffic Injury Prevention Report, released in 2004, revealed that speed has an exponentially detrimental effect on safety. As speed increases, so the number of severity of injuries. Studies have also shown that the higher the impact speed, the greater the likelihood of serious and fatal injury. And because of these reasons, MMDA has implemented the 60 km/h speed limit along with major thoroughfares such as the Macapagal and the Commonwealth avenues. Using handheld guns, our traffic enforcers detect speeding vehicles, and those who are detected for speeding are apprehended and issued corresponding traffic violation receipts. Next slide, please. Studies have shown that automated enforcement devices have the potential to reduce the level of traffic policing resources required while providing an effective and efficient means of detecting and deterring traffic offenders. Through the use of CCTVs and handheld cameras, our authorized traffic personnel distinctly capture errant motorists. Such devices can increase the amount and relevance of information or feedback provided to the road user, thus can result in decrease in the likelihood of an offense being committed and improves compliance to road rules, thereby increasing road safety consciousness. Next slide, please. Alarmed by the increasing number of road crashes involving motorcycles, MMDA has designated non-exclusive motorcycle lanes or blue lanes along EDSA, Commonwealth Avenue in Quezon City, Macapagal Avenue in Pasay City, and along CP Garcia or C5. And true enough, because of this policy, a reduction of road crashes involving motorcycles was recorded in Commonwealth Avenue in particular in the past 3 years. Next slide, please. We believe that with our intensified sidewalk clearing operations, we were able to recover in most major roads of Metro Manila spaces and sidewalks that are used to be occupied by illegal structures, thereby promoting pedestrian safety. Secondly, our track lane policy along C5 is also believed to have contributed to the decline of road crashes from 31 fatal crashes in 2019 to 18 fatal crashes in 2020. The same is true with our intensified operations against illegally parked vehicles. We believe that towing and impounding of illegally parked vehicles along major thoroughfares have positive impacts in ensuring safety of road users. Next slide, please. May I now present to you the updates of the road crash data based on our MARAS database. And I'm sure we have had a very comprehensive presentation, which was presented by Dr. Lu and Dr. HERBOSA on the accident analysis, particularly in Metro Manila. Flash on the screen is a road crash trend in Metro Manila for the past 11 years. In this period, an average of more than 90,000 a year road crash each year happened in Metropolis. From 2011 to 2019, we can see the increasing trend in the number of crashes as it registered an annual average increase of 5.5%. Although in 2020, the number of road crash cases has plummeted up to 46%, perhaps because of the lockdowns and the COVID-19 pandemic. Next slide, please. While there is an increasing road crash cases in Metro Manila, in terms of the crash rates, which can be determined by measuring the number of deaths by 10,000 registered vehicles. And there are other, of course, methods in determining crash rate. It appears that from 2016 to 2020, crash rate has been gradually decreasing from 1.77 deaths per 10,000 vehicles in 2016 to 1.5 deaths in every 10,000 vehicles in 2020. Next slide, please. In the 3-year period from 2018 to 2019, ages between 18 to 34 years of age appeared to be the most vulnerable age group in Metro Manila, registering an annual average of more than 3,500 persons who are either killed or injured in road crashes. Next slide, please. Among the three user groups classified under our MARAS database, drivers seem to be the most vulnerable user group within the period 2018 to 2020, with 37,291 and 655 recorded cases for non-injury crashes and fatal crashes, respectively. And on the average, there were more than 6,300 drivers, more than 2,400 passengers, more than 2,000 pedestrians were either killed or injured each year due to road crashes. Next slide, please. To be honest, one of the problems in our database is that causes of road crashes are mostly unknown. We do admit that there are lapses in collecting the correct information, primarily because police investigators would not immediately input the data on the MARAS database, particularly when the results of the investigation are still premature. So these are one of the problems that we are encountering in the database system. But of course, from the known causes of road crashes reflected in our MARAS database, for the same period, we have 95% of road crashes were caused by human errors. Errors like inattention or distracted driving, driving too close, DUI, recklessness, and illegal driving behavior are very much evident. Next slide, please. Now, in terms of the type of vehicles involved in road crashes, from 2018 to 2020, private cars registered the most number of cases with 294,525 cases, followed by motorcycles, which make up around 15.3% or 89,475 crash cases, and a little over 9% were crash cases involving public transport services, which is also alarming to note. Next slide, please. Next slide, please. Okay. Flash on your screen is the distribution of road crash data by month. If we look at the graph, months of March, July, and October in the past 3 years have registered the highest number of road crashes. There seems to be a pattern, but of course, we have yet to carefully investigate why there is a spike in road crashes during these months. Next slide, please. Now, on your screen is the distribution of road crash cases by hour of day. While 63% of road crashes or road incidents happen during daytime because there are more people on the road, which should mean that there is a greater chance of having an accident. But in reality, driving at night is actually the most dangerous time to drive. Our data tells us that in the past 3 years, about 64.5% of fatal crashes happened during nighttime, where poor visibility, presence of glaring objects, fatigue, speeding might have been the causes or factors causing these crashes. Next slide, please. Now, looking at the motorcycle crashes, in the 3-year period from 2018 to 2020, on the average, more than 10,800 riders and more than 2,300 passengers or their back riders were either injured or killed each year from 2018 to 2020. Sadly, motorcycles or motorcycle to pedestrian collisions recorded 5,587 pedestrians were killed or injured in the past 3 years, or on the average, 1,862 pedestrians per year are killed or injured by motorcycles. Next slide, please. Flash on your screen are the major arterial roads in Metro Manila, which you consider as black spots based on our MARAS database. If you will notice, arterial roads that carry higher volumes of traffic register the most number of road crashes. Among the 12 major arterial roads listed or identified under the MARAS data, only Commonwealth and Quezon Avenues have recorded a decreasing road crash incident as their traffic volume decreases, compared to the rest of the arterial roads where road crash rates increase as their traffic volume increases. Next slide, please. Now, let me deal with some road safety issues and concerns in the Metro Manila. Number one would be the increasing traffic volume as a risk factor. When traffic volumes are factored in on the crash data, it appears that there is a correlation between the volume of motor vehicles and the number of road crashes and injuries. Studies have shown that as volume of traffic increases, the crash rate also increases. This therefore draws the attention for the need for careful consideration and planning of transport and mobility in view of the increasing motorization in Metro Manila. Secondly is the vulnerability of motorcycle riders and pedestrians. As presented earlier, there is growing concern about motorcycle crashes and collisions between motorcycles and pedestrians. We really need to adopt a safe systems approach to reduce the involvement of riders and pedestrians in road crashes. We should strengthen compliance with key road safety measures by setting and enforcing speed limits, enforcing alcohol impairment laws, enforcing mandatory use of helmets for motorcycle riders. And in the case of pedestrians, we believe that we should minimize the exposure to high-risk scenarios and strengthen the role of education, information, and publicity to improve their level of awareness, among others. Third is the growing concern of public transport involvement in road crashes. Again, as presented earlier, the involvement of public transport in road crashes makes about 9 to 10%, or roughly 10% of the total road crash incidents from 2018 to 2020. Public transport produce dangers for those who ride, and also maybe because of risk to other road users. This is particularly so as the size of the vehicle increases, and drivers and the vehicle defects have significant role in public transport vehicle crashes. There are also many road-related factors that also influence risks, such as high speeds, uncontrolled movements, and turns, especially at intersections and access points. Fourth is the increasing crash incident rate in Metro Manila. Over the past 10 years, road crash rate rose from 214 per day in 2010 to 334 per day in 2019. On the average, there are about 257 road crashes happening in Metro Manila each day, and these are recorded cases only, and it might be higher than the recorded figure. Fifth is undisciplined, poor driving behavior of motorists. These are common causes of road crashes, and it usually involves high speeds or extremely dangerous driving tactics. It often results in injury or death of one or more people involved. Fortunately, crashes due to poor driving behavior, such as recklessness, can be prevented. We should therefore adopt an enforcement or policy measures that will restrain motorists to drive recklessly and improve compliance to road rules and regulations. Next slide, please. So I think this is my last slide. Thank you very much for inviting MMDA for this series of webinar. Marami pong salamat at mabuhay po tayong lahat.
Thank you, Mr. Pagulayan, for informing us of the initiatives and efforts of MMDA in the aspect of enforcement and policy measures. The MARAS database, showing the increasing traffic volume and crash incident rate and poor driving behavior, serves as impetus for all of us to work even more in increasing awareness for safe behavior on the road. Surely, road safety is everyone's responsibility and should be everybody's priority. Are you a segurista or a prudent person? A person who acts and shows care and thought for every action. Meet Josefina Segurista to remind us to always stay alert and be a segurista.
Si Josefina Segurista? Hindi yan naglalagay sa cart nang di tinitignan ng expiration date. She makes sure na no harmful ingredients ang groceries. Sigurista yan pagdating sa freshness ng food ng kids. At sa clothes, aba, dapat walang damage. Ayan si Josefina Sigurista. Pero, sa road, sigurista rin ba siya? Oops! Ako, Josefina. Dapat sa pagmamaneho rin ay sigurista. Mag-seatbelt para iwas disgrasya.
We want everyone to translate these video messages into our declaration of real actions on every highway, on every street, and on every road. Surely, road safety is everyone's responsibility and should be everybody's priority. The Land Transportation Office promotes safety and comfort in land travel by ensuring safer vehicles and road behaviors. To discuss with us the role of LTO on road safety in the areas of safer vehicles, safer road behaviors, and better enforcement, we have speakers from LTO Central Visayas and LTO Davao. Our speaker from the Land Transportation Office Central Visayas is Regional Director Victor Emmanuel C. Caindec. Director Caindec obtained his degree in business management from the University of the Philippines. He served as the executive director and chief manager of the City Traffic Operations Management of the Cebu City Government. He worked as a member of the Board of Directors, City Traffic Operations, where he provided inputs on matters relating to strategic traffic and transport management, infrastructure, and sustainability.
Good morning. Good morning to Dr. Teddy Herbosa and Dr. Jinky Lu. I hope you can hear me well.
Yes, we do. We hear you well.
Thank you. Allow me to give you a brief of our presentation. In behalf of the men and women of LTO Region 7, we call this our journey to a smart way home. The presentation will be in 4 parts. I'd like to give you an overview of our agency performance in the region. I'll touch very briefly on the developments in land transport policies. Next slides, please. And we'll share with you some of the challenges that we are seeing to safer roads in Region 7 and some of our actions taken. And we'll run you through our Malasakit outreach program as a response to our initiative for road safety in Region 7. So allow me to begin. Next slides. LTO Region 7 is an agency that's comprised of 27 frontline offices. We are one of 5 regions in the country for LTO collecting over 1 billion pesos in revenue. We have almost over 1 million vehicles registered in the region in 2019, and we handle about 8,920 transactions daily, or an average about 300 plus transactions per office. and we are backed up by 203 regular LTO personnel. Next slide. We have opened 8 new offices since January 2018 and upgraded 6 of our offices, and we're set to open 2 new offices in 2021. In the expansion of our offices, I'd like to highlight that it's been a long time coming, but we have finally opened 2. Sorry, back to the previous slide, please. We have 2 offices now in the major islands of Bantayan and Camotes, which is significant considering that these islands have increased populations over the past 10 years and has been previously unserved directly by LTO. We have also annexed and opened a new district office in La Libertad, which increases our coverage in Negros Oriental, extending northbound to the border of Negros Occidental. Next slide. Now, I want to highlight quite a heavy slide, but I'd like to highlight 2 points in this executive summary. You will see that the motor vehicle transactions of LTO Region 7 have been on an upward trend, yet our license and permits issuances are on a downward trend. This is significant considering that this basically says there's more vehicles being registered in the region, and yet we are more strict in the issuance of driver's licenses. And in the next slides, I will highlight why this is also important. Next slide, please. Now, before I go to specific issues and developments in a region, allow me to just very quickly touch on the developments in land transport policies. There are several. We have the seatbelt law, we have the motorcycle helmet law, the Safety of Children in Motorcycles Act, we have the extension of the 5-year license and the development of the Special Protection for Children Passengers in Motor Vehicles Act, or the Child Seat Safety Act, and also a very interesting law, RA 11235, which people call the doble placa, but in reality, the importance of this law focuses on the need for a 5-day registration window for registration of motorcycles. So next slide, please. So across these transport policies, you'll see that vehicle safety, vehicle regulation, and driver competency are addressed. For vehicle safety, that means to say that we now have more stringent guidelines on vehicle safety, mandatory installation of seat belts and helmets usage for motorcycles. This is also paving the way for the operation of private and modern motor vehicle inspection centers. In terms of vehicle regulation, motorcycle usage means that there's no excuse for anyone using a motorcycle not to have a registration of the motorcycle, especially that the law provides a 5-day period whether it's new or transferred to another owner. Again, the safety guidelines are in place. The last part on driver competency is interesting. We have extended the validity of driver's licenses to 5 years. And also, last year was the full implementation of the LTO ACES, or Automated Certification and Education of Student Drivers. Now, across all of these developments on land transport policies, why are we still experiencing road safety issues? Next slide. Let me go to specific points in Region 7 and what are the challenges that we see as roadblocks or policy issues that we need to address. Next slide, please. Well, Region 7 is composed of 3 highly urbanized cities, 4 provinces, and 3.5 islands. When I say 3.5 islands, that is because the island of Negros, Region 6 is responsible for Negros Occidental, while Region 7 is responsible for Negros Oriental. That means to say we're looking at separate traffic ordinances, separate traffic management and enforcement units. We also have to deal with local populist policies, and I say this in a very objective manner. We are seeing interventions, or at least pronouncements from local government units asking for higher tolerance, for the use of helmets and seatbelts. There's a lot of tolerance for the use of tricycles, e-bikes, and non-regulated modalities on national roads and highways. And this is also creating mixed signals across the populace. Next slide. We're also looking at a movement or a development in transport infrastructure that is driven by already a helmed regional development plan. For RDC7, they call it the Regional Spatial Development Strategy, which basically aims to spread out development across the various provinces and urban centers in Region 7. What this basically means that as development in Region 7 moves outward from the urban center of Cebu, Tagbilaran, and Dumaguete, it also means that it will be triggering people movement. People movement necessitates increased demand for transport modalities. Number 3, next slide. And I see Chairman Delgra in the forum here. I'd like to say that I'm just using this as to borrow his term, predicating the statements of the next slides. But LTFRB issued a memorandum circular in 2003, which put a moratorium on the issuance of a certificate of public conveniences. Basically, no new franchises were issued, which affected capacity across the regions. While this has been already addressed with the POB modernization program, the impact of this long-standing moratorium actually caused a spike in growth of private vehicle ownership, informal transport modalities, which, my apologies, it's called colorum vans. And habal-habals are motorcycles that are being used as taxis. And tricycles are basically tricycles driven by bicycles. Also, there's triggered growth in demand for motorized personal transport. And allow me to share with you the next slide. The next slide shows our vehicle registration. The first chart shows that the blue line on the first chart shows that over 61% growth versus the baseline of 2010 in terms of SUVs and cars registered in Region 7. The middle chart shows the spike in new motorcycle registrations versus cars and SUVs. And the last chart will show the cumulative count of motorcycles in Region 7 over the past 10 years. It's 1.2 million. Next slide, please. Now, why is this significant? Because 68% of motorcycles comprise 68% of registered vehicles in Region 7. However, if we look at the total number of currently registered motorcycles in a region, that's roughly about 50%. And thus, this is our biggest road safety challenge. Next slide. So what have we done? And let me just breeze through very quickly these initiatives. Next slide. We are working closely with local governments. We are an active member of the traffic boards of Cebu and Bohol. We're working with the BRT Task Force, the Cebu Bridge Management Board. The LTO7 is also co-chair of the Interagency Council on Traffic in Cebu. And we are pushing for local government unit support for a cohesive action on road safety across the borders of Region 7 to the extent that we have made representations to the Office of the Presidential Assistant for the Visayas. We're also working closely with local civil society groups. Next slide. Sorry, next slide, please. We are very participative and active in sharing our narratives on road safety. We have our own kapihan. Before the COVID hit, we're doing this bi-monthly, and we're also working with the IBP Cebu to push for the DILG-DOTR-DPWH Joint Memorandum Circular 2018-001. Next slide. Yeah, we went to as far as going to participating in Sinulog, which is one of the largest festivals, the street festivals in Asia Pacific, and we commissioned a very popular social media personality. Her name is Jet Li, who's very popular with the motorcycle crowd, just to highlight our messaging on road safety. Next slide, please. Again, because we are focused on addressing the issue of motorcycle safety as part of our advocacy, we also launched the Motorcycle Unity Ride in 2019, which was participated by the Highway Patrol Group, the PNP, several LGUs, Cebu Media, and of course our partners from the motorcycle clubs in Region 7, again highlighting the message of road safety the smart way home. Next slide. We did, one of the things that we did for Christmas was an advocacy for road safety in a place called Trans Central Highway. For those that are familiar in Luzon, this is the Marilake equivalent of Cebu, which has been the place of so many accidents and so many issues on reckless driving. We went there, we went to the mountains, we distributed rice and helmets and even driving education course certificates to people from the mountain barangays to get their engagement in and working with them to convey the message of road safety in Region 7. Next slide, please. Very quickly, this perhaps encapsulates most of our initiatives in our road safety action plan for Region 7. We call it the Malasakit Outreach. Next slide. What is it? Basically, it's a bus. It's an LTO office in a bus. What makes this different from the previous initiatives? Our bus is small. The bus in Luzon and other parts, I think, are large buses. We converted our bus to become small so that it's agile. It can go to the mountain barangays. It can go to different locations, and we can park it very conveniently where we have to in our outreach program. We work very closely with the local government units who help us with the cost of board and lodging as well as on-site crowd management. And people, when we bring our LTO bus into the different municipalities, we offer the driving education course, which is a requirement for the issuance of a student permit, and many of our frontline services, which includes registration renewal, license renewals, and student permit issuances, among other services. Next slide. We have served over 36,000 individuals in 70 municipalities. We launched this in February 2019. The driving education course, which was started in October of last year, has already produced over 2,000 graduates. And our bus, the Malasakit program for the driving education, has gone to 22 municipalities already since October of this year. And the graduates are able to now secure their student permits without having to go to the regular LTO offices. So last few slides. Next slide, please. Next slide. Next slide, yeah. Just one slide back, please, just before I end. Yeah. Again, let me just put in the numbers for Malasakit. We have produced over 2,000 graduates, about 16,000 vehicles registered via this outreach program, and over 20,000 licenses and student permits issued. We have gone to the mountain towns of Canlaon and Gihulngan in Negros, the midland municipalities of Carmen and Danao, among several other municipalities in Bohol, and we have even gone to the island of Tudela, which is an island in Camotes, normally accessible through Ormoc. Our Malasakit program is going to the grassroots, and this is our way of ensuring that our road safety advocacy is connected to making sure that people have their licenses, their vehicles are properly registered, and those that are unable to avail of LTO services are reached by government. And in the next few months, we'll be launching our Historia Tabay Road Safety Talks in Communities, which will also be an attached program of our Malasakit program. So this is my last slide. Thank you very much for the opportunity for sharing our story in Region 7. Magandang araw po sa inyong lahat and mabuhay.
Thank you, Director Kaindek. Our next speaker is the Assistant Regional Director of LTO Davao Region, Chief Regional Director Neil M. Caniedo. He obtained his Bachelor of Science in Business Administration with a double degree in Marketing and Management and his Master's degree in Business Administration from the Ateneo de Davao University. Through his leadership, LTO Davao Region has been actively enforcing the compliance of road and traffic laws, speeding rules, and surveillance of drink driving. Regional Director Caniedo.
Have a pleasant day, everyone. Before I start my presentation, I would like to thank the organizers headed by Dr. TEODORO HERBOSA and Dr. Jinky Leilani Lu for inviting me to be one of the resource speakers to this significant webinar on road safety. I am deeply honored to be part of this program. The topic which I would like to share this morning is actually the entire program and projects on road safety that LTO Region 11 has initiated and implemented, considering this is our primary mandate to keep all road users safe. Over the past years, the Philippines, our country, has achieved progress in road safety legislation, but the high incidence of road traffic injuries and fatalities remains a major public health and development concern. We have seen how these legislations may be local or national laws such as Executive Order Number 39 or an order setting the speed limit within Davao City, the Anti-Drunk and Driving Act, the Anti-Distracted Driving Act, use of seatbelt, motorcycle, helmet, protects people primarily to save lives. We need better enforcement of these laws. However, a multifaceted approach is required in order to achieve the most effective and long-lasting safety on the road, considering the road crashes are not accidents. We need to challenge the notion that the road crashes are unavoidable. Instead, we should make a room for a proactive and preventive approach to reduce tragic deaths and injuries on our roads. We, in the Land Transportation Office, as we commit to make our roads safe, came up with its own road safety policy framework based on its mandate, and the Region 11 actively implementing all these programs through: first, intensified enforcement of Republic Act 4136 and other special related laws; information dissemination on the proper use of bicycle lane. During this time of pandemic, public transportation is immensely limited due to government restrictions. Promotion of bicycle use is now being intensified, not only for health and leisure purposes, but also as an alternative solution for lack of public transport. Our region has taken its initial step towards educating the rising number of cyclists now using major highways in the city of Davao. Sufficient attention should be granted to the needs of the cyclists who are considered vulnerable road. Making roads safer will not be possible unless the needs of these road users are considered in all approaches to road safety. All these are critical points that need to address properly. Last May 22, 2021, along with our cyclist employees here in Region 11, we conducted road safety campaign for cyclists to raise awareness on road safety and courtesy and traffic rules on bicycle lane. We handed out leaflets which will help them to understand the importance of knowing the rules on bicycle lane as well as the use of the bicycle safety gears. Roadside inspection is regularly conducted by the Land Transportation Region 11 law enforcement units to ensure the vehicles operating in the highway are safe and roadworthy. During said inspection, our law enforcement unit will inspect the condition of the tires by using tire depth gauge, considering that tires have vital functions which are essential for safe driving. Emission testing on motor vehicles is also regularly conducted by our team by using our portable emission testing device. We ensure that vehicles operating in the highways are compliant that primarily benefit human health and environment. Our region intensified its anti-colorum operations and continuously encouraged the public not to patronize the use of this illegal transport service, considering the danger and risk of these vehicles. Similarly, we regularly enforce the law on overspeeding by using our handheld speed camera. This is a part of the no-contact traffic apprehension policy of Land Transportation Office Region 11 that will apprehend vehicles violating the said law. We had several apprehensions also for drunk and drug driving violation, the Republic Act 10586, which we regularly carried out in our region but temporarily suspended due to pandemic restrictions. We actively part in the filing of the case to the court, and majority of the accused drivers have been criminally charged under this law. The law enforcement team likewise enforce anti-overloading operations, considering the excess load may prejudice the safety of the vehicle. Randomly night operations were carried out by our enforcement team. It is very important that the motor vehicles operating at night are safe and roadworthy because road crashes most likely occur during nighttime. Garage inspection for buses is also regularly implemented, and we constantly monitor the installation of the speed limit device in compliance with Republic Act 10916. Strengthening the workforce in the law enforcement service. First, the deputation of the PNP personnel. Due to lack of personnel of LTO, there is actually a need to deputize our PNP personnel and become our traffic law enforcers who would assist us in the conduct of regular roadside operations and apprehend traffic violators. Retooling seminar for the land transportation personnel are regularly made twice a year to ensure that our deputized agents are updated with the traffic laws, rules, and regulation in order to effectively carry out their function as law enforcers. Aside from the retooling seminar, our region conducted a seminar on emergency medical response training for our law enforcement team, with representatives from the 911 emergency medical team as the resource speakers and trainers. Since road crash may occur anytime on the road, it is important that our law enforcers can assist the road crash victims by providing them first aid treatment, thereby preventing fatalities and serious injury. Just like this video we had, Traffic Regulation Officer Montenegro and PRO Atienza, both registered nurses of law enforcement team, assisted the victim in road crash accident. Our law enforcement team is not just performing law enforcement but also discharging emergency medical response during road crash. Third, promotion of the use of the drive-through facility for the renewal of motor vehicle registration. Just last year, after declaration of pandemic, LTO Region 11 has set up this drive-through facility in response to the need of regulating number of clients inside office premises. Through this facility, the client have saved their time and adds to their convenience considering the processing time of the less than 30 minutes without compromising vehicle inspection. Most important here is that we prevented our clients and employees from the possible transmission of COVID virus. Implementation of Republic Act 10930 by mandatory theoretical driving course and practical driving course and regular conduct of trainers training for accredited driving instructors of the DEC driving school and TESDA personnel. Student permit applicant shall now be required to attend the 15-hour TDC before they can process their application for student permit. Thereafter, when they will apply for new license, an 8-hour PDC is another mandatory requirement. This will ensure that the only individuals with sufficient driving skills and knowledge on the road safety and traffic laws, whose eligibility is determined by passing the LTO conducted theoretical and practical examinations, can acquire the driver's license. Developing qualified drivers is very important since human factor remain major cause of road crashes. To intensify further the implementation of Republic Act 10930, Region 11 executed a joint memorandum of undertaking on November 24, 2019 with Department of Education, Department of Public Works and Highways, Department of Internal Local Government, and the Philippine National Police as parties to this Memorandum of Agreement. This is part of the Land Transportation Region 11 Road Safety Campaign that seeks to raise awareness for students and young adults, particularly senior high school, to the basic rules on road conduct and safety through lectures and made an integral part of the school curriculum. Since face-to-face classes remain suspended due to pandemic, road safety lectures are conducted through online platform. The lectures primarily provide essential information on rules for safety, driving, road courtesy, and traffic discipline. Another significant project we conducted is outreach program. This program will benefit clients from the far-flung areas who have no means to personally appear in the land transportation offices. Our outreach program focuses on areas such as Paquibato District, Mapula, Marilog District, Talaingo District, which are known to be rebel-infested areas. By any chance, conduct of road safety audit is likewise initiated by LTO Region 11 along Davao National Highways. This project by actual examinations of an existing road will assess the road safety in order to minimize road accident occurrence. Identifying which roads are considered dangerous, who commonly uses these roads, and which road users are most likely to be injured can all help to determine what countermeasures are most essential for upgrading the road and making it safer. Proper installation of road signages and markings, pedestrian crossings, and improved road layout will provide certain and immediate reduction of road crash. To intensify road safety audit in Davao City and to promote convergence with other government agencies, LTO 11 has initiated for a creation of a comprehensive and unified road safety audit board. This is composed of the local government unit of Davao, Department of Public Works and Highways, the Philippine National Police, the Public Safety Command Center, and the City Traffic and Transport Management Office. This board shall undertake to address the findings during road safety audit and recommend corrective actions. And lastly, the LTO Region 11, in commemoration with the World Day of Remembrance, which falls every November, has coordinated with the local government of Davao and came up with Proclamation Number 8, Series of 2019, signed by the City Mayor Sara Duterte Carpio, declaring the month of November as Road Crash Prevention Month in the City of Davao. A long-month road safety program, like providing lectures, seminars, and series of events like poster and video making contest, focuses on road safety issues and concerns are usually conducted. In summary, the Region 11 unceasingly pushes for the safety of all road users through drivers' discipline, strictly enforcing road safety laws, conducting road safety audit, and campaigning for the use of safer vehicles. Safety shall always be a paramount importance to the Land Transportation Office. Thank you and a pleasant day to all.
Thank you, Director Cañedo, for a wonderful presentation on your programs. When it comes to road safety, we cannot neglect the importance of enforcement and road crash data, which the Philippine National Police is mandated to do to ensure public safety. From the PNP Highway Patrol Group, we have Police Major Ryan C. Palaran. He has a bachelor and master's degree in criminology. Police Major Palaran will discuss road crashes and road safety enforcement on behalf of the PNP Director for HPG and the IDM.
Good morning to everyone. Magandang araw po sa lahat ng participants. Maraming salamat po ako'y inyong inanyahan dito sa inyong seminar, webinar. Ako po yan nalulungkot na nandito. So in behalf of the men and women and under the leadership of our Director, Police Brigadier General Alexander Camilantagum, I am Police Major Ryan Palaran, the Deputy Chief, the OIC of Police Community Relations and concurrently Public Information Officers. So, what will I discuss today is, this is the presentation that always I use pagka po nagtuturo ako sa grassroots level ng mga drivers, mga ordinary drivers na tinuturuan po namin. So, it's all about road safety, a shared responsibility. Hindi po siya ako lang ang nakakaalam. Kailangan po lahat po ng gumagamit ng kalsada, kailangan po alam po nila kung paano gumamit ng kalsada. Okay, next slide please. So the sequence of presentation are as follows. The road safety education, the attitude of the driver, and the data on road crashes. Next slide. So, marami na pong presenter kanina, paulit-ulit po yung sinasabi nila na road safety is it's all about safety and how to prevent the accidents. Okay, so road traffic safety refers to the methods and measures used to prevent road users from being killed or seriously injured. Road users includes pedestrians, cyclists, motorists, vehicle passengers, and passengers on road, public transport. So everyone that's using the roads are road users. Okay, next slide please. So, ano po ba yung mga nakaka-apekto? Number one, sa pagmamaneho. That's the attitude of every driver. Kaya po tayo nagkakaroon ng aksidente. Number one na factor is the attitude of the driver. So kailangan po ang isang driver, ang isang operator of a motor vehicle, kailangan may concern siya sa ibang road users. So he must be recognized that other users will also make a mistakes. So kailangan defensive din siya, defensive driver. Next slide please. So for the attitude, no journey is so urgent that is a safe speed can be maintained. So kanina po yung isang presenter na rinig ko po na safe speed is the best policy. So within the speed limits po, kailangan po nating i-always observe. So when driving a motor vehicle, so driving skills is also one factor which requires application of good techniques, and we believe that safe driving requires an alert mind at all times. Next slide, please. So, kailangan po ideal defensive driver. Never forget po ang pagsusuot ng seatbelt. Paulit-ulit po dun sa ating mga presenter to be safe. So, to be safe, always buckle up. Sa mga four-wheel vehicles po yun. And for the motorcycle naman po, automatic, that is the helmet and the jacket, other safety protective gears. So, keeps within the advisory limits, the speed limits, constantly scan the road for potential hazards. So, kailangan nag-i-scan during driving, yung driver, pinipredict niya na po kung ano po yung mga potential hazards to prevent accidents. Next slide. Next slide, please. So, okay, every driver should have a right mental attitude. So, a defensive driver always maintain a safe caution of distance in front and behind of his vehicle. So, observance po ng 4-second rule and adopting a positive and skilled mental approach. So, 4-second rule, for the 4-second rule, ma'am, there must be a reference point na within a 4 seconds, kailangan nandun ka sa reference point na yon. Yung sinusundan mong sasakyan, from that reference point, kailangan nandun ka. So, kung for the 2 seconds lang at nandun ka na, ibig sabihin, masyado kang mabilis dun sa sinusundan mong sasakyan. Okay, next slide please. So, next slide please. Okay, search the road scene ahead, around, and rear of the vehicles. Identify the potential and immediate hazards on the road. Driver must always predict the actions of other road users and decide what to avoid in unsafe situations. Okay, next slide please. So, yung mga, as an introductory, that's all the basics. Bakit po tayo nagkakaroon ng kadalasang aksidente? Kanina po, napanood ko po sa isang presenter po natin, yung video po ng accidents ng motorcycle and yung dalawa pong four-wheel vehicle na nagbanggaan sa intersection. Bakit po nangyayari yun? Aminin na po natin na napakadami po ang marunong magmaneho. Marami pong driver ang marunong magmaneho. No questions asked. Pero iilan lang po ang driver na marunong gumamit ng kalsada. So, the Republic Act 10752, the Right of Way Act of the Philippines. So, iilan lamang po ang nakakaalam ng right of way na tinatawag. Especially po dito sa highly urbanized cities like Metro Manila, araw-araw po nating challenge yung pagdadrive because of specifically the motorcycles. So, motorcycles, kahit saan po sila lumulusot, kahit saan sila dumadaan, as what they please, as what they do. So, sa amin po, sa law enforcement, nalulungkot po kami na mas marami po kaming nahuhuli. Kasi po, pagka po mas marami kaming nahuhuli, automatically means na mas marami po ang hindi nakakaalam ng ating batas trapiko. So, we always conduct traffic safety education to them. So, for this series, on our organized motorcycle riders group, regularly po kinokonduct po namin yung road safety and traffic accident prevention. So, in order to prevent intersection accidents, vehicles that are first to arrive at the intersection are the ones with the right of way. So, if you arrive at the intersection almost or exactly the same time as another car, you must give way to the car to your right. In case you will turn left, you have the right to of way only if you have signaled your turn at least 30 meters away in most instances. However, the first rule still applies. So, ito pong right of way act na to is a basic na basic po. Nakalagay din po itong provisions na ito sa Republic Act 4136, the right of way rule. So, in-specify lang po siya ng batas ng 10752. So, inelaborate po siya dito. Ito rin po yung mga bagay na tinuturo namin during our seminars. Sa mga ordinary drivers, public utility drivers specifically, and motorcycle riders group. Okay. Next slide, please. So, as shown, the right of way during the first come, first serve, first come, first to out. Okay, ayan po yung mga as shown in the picture, ayan po yung right of way nila. So, when turning on the right, the red, you must give way to the blue car. It's just the same with the yellow car. You must give way to the other cars that passing through. So, isa lang po ito sa example ng right of way. Napakarami po nito, rotonda rule, on a curved line, when to pass or when not to pass, marami po siya. So, this is the most basic po na kailangan pong malaman ng ordinaryong driver. At yung po ang nakakalungkot. Kasi po, in my experience sa field, karamihan po ng violators na nahuhuli namin, definitely, isa lang ang sagot nila, "Sir, pasensya na at nagkamali ako. Hindi ko kasi alam yan." So, isa lang po ang aming sagot sa bagay na yun. Paano po? Nag-seminar po ba kayo? Opo, sir. Kaya lang po nakaligtaan ko. So, it is not the reasons why na nakaligtaan mo. Kasi there are others na that you are compromising the safety ng mga road users. So, kung nakaligtaan mo, yung ganyang klaseng regulations, you can contribute an accidents. So, very strict po kami pagdating sa law enforcement. Next slide, please. So, as you can see, okay, I am only to put, okay, thank you for the, Charina. Okay, for this, I can only show you is ito pong picture na to is madalas po nating makita hindi dito sa NCR, mostly sa provinces. Kasi konti po ang mode of transportations doon. They call this as habal-habal. So kung makikita po ninyo dito sa picture, very prone sa accidents po. Aside sa overloading, all passengers are not wearing seatbelts and the children. So sa ganito pang pagkakataon or instances, definitely nire-recommend po namin ito na masuspend po yung driver sa LTO once na mahuli po namin. Kasi this kind of driver is very irresponsible with regards to the safety of others. Okay, next slide please. Share ko lang po sir yung aking experience sa pagtuturo. One of the participants I have asked is kung anong klaseng symbol to, itong mandatory signage na to. So tinanong ko siya, he's been driving a public utility jeep for at least 15 years. Medyo may edad na rin yung participants po natin. And then for 15 years po na driver niya as a public utility for public utility vehicles, ang pagkakaintindi ko po is very familiar na siya sa mga road signs natin. So one of the road signs that I asked to him, ano po bang klaseng road signs ito? Very simple po. And he answered seriously, "Sir, isa lang po yan. Napakadali naman yan, nagyabang pa eh." Pero totoo po yung sinasabi. He answered seriously, "Sir, ayan po ang tinatawag na no double parking sign." So, no double parking sign. So, definitely, nag-post po ako dun sa sagot niyang yun. And I have to immediately rectify the mistake. Kasi po, iba yung the way he thinks. Is 15 years na po siyang public utility driver and he answered no double parking signs for that. So, kung makita po niya yan, na bumabaybay po siya sa isang two-way lane, two directions, at nakita niya yan, inisip then, he can immediately overtake kasi ang pagkakaintindi niya dyan is no double parking sign along that roadways. So, accident prone siya. Pwede siyang mag-contribute ng accidents kasi ang pagkakaintindi niya is no double parking, whereas no overtaking signs po yan. Okay, next slide please. Okay, these are also the pavement markings that we lectured to them. So, another experience na i-share ko po sa inyo is yung nagtanong po ako sa isang participants, bakit po meron siyang dotted at meron siyang solid line. So, hindi ko pa po pinakita kung ano po yung mga nandito sa baba niya na captions. Binlang ko po siya for them na masagot po nila incorrect yung pavement markings. Okay, so isa po sa participants is also a jeepney driver for that. May bus experience na rin po sa pagmamaneho. And then, public utility vehicle. And then, he answered me, "Sir, kaya po dotted yung iba na yan. Isa lang po ang ibig sabihin yan. Para po makatipid ang gobyerno sa pagpipintura ng ating kalsada. At para po magkaroon po sila ng pocket money." Ganon ang pag-iisip po niya. So, ang pag-iisip po niya, sinadya ng gobyerno na gawin siyang dotted lines para po magkaroon ng pocket money yung mga gumawa ng pavement markings. Whereas, hindi niya alam kung ano talaga ang purpose niyan. So, for that incident, I also rectified his mental attitude and behavior for that. Kasi po, it is very sad to hear na he has a very vast experience on driving and considering that his profession is a public utility driver, he must knows everything. Ano po yung mga road signages na dapat. Yun nga po, nakakalungkot lang. And then okay, next slide please.
Thank you very much, Major Palaran. We have learned a lot from our speakers and we apologize for that because we are pressed for time. We have another road safety video campaign for you. You can download our videos and share with your friends. Tandaan, kapag inaalagaan, nagtatagal. Remember, if you care, it lasts long. Watch and learn about the acronym BLOW Baguettes.
Remember, blow baguette. Check your battery, lights, oil, water, brake, air, gas, engine, tires, and cell. Road safety is everyone's responsibility and should be everybody's priority. Now we have the
Dad,
chief.
nakaka-amaze na hatid sundo mo pa rin si mom sa work hanggang ngayon.
Alam mo ba kung gaano nakatagal sa atin yung sasakyan?
Matagal na, sa tingin ko. Bigay pa yan ni Lolo sa'yo nung bata ka pa, di ba?
Alam mo ba kung bakit tumatakbo pa? Kasi lagi natin kinakamusta. Kung may sira ba? Kung meron pa tayo dapat baguhin o palitan. Ginagawa natin yung lahat para secure kapag nasa kalsada na. Anak, kapag ang isang bagay inaalagaan, nagtatagal. Kapag inalagaan natin ang pamilya at buhay, siyempre magtatagal din.
Bago magmaneho sa lansangan, always check your car. Tandaan ang acronym na BLOW BAGGETS. I-check ang battery, lights, oil, water, brakes, air, gas, engine, tires, at self o sarili.
Now we have the Division Chief of the Program Implementation and Outreach Division of the Health Promotion Bureau of DOH, Dr. Alfonso Miguel R. Regala, as our reactor. Dr. Alfonso Ponce Regala previously served 4 years in Northern Samar and was Chief of Hospital at Dr. Gregorio B. Tan Memorial Hospital. Dr. Regala holds an MD and MBA from Ateneo School of Medicine and Public Health as an Ateneo Scholar and is part of the inaugural cohort of the Obama Foundation's Leaders for Asia Pacific in 2019 and Tatler's Generation Key Leaders in 2020.
Hi, good morning to everyone. I'll just give a very quick reaction to our presentation this morning. So first of all, thank you for the informative sessions today and the individual presentations. 3 things lang po. It is great that road safety was highlighted as a shared responsibility, whether you're in cars, trucks, motorcycles, bicycles, or pedestrians on foot. And it's also good that we have this data on our crashes and other important factors, so we can prioritize our work on solutions. So the first point is part of this shared responsibility and identification of solutions is finding the right mix of policy, education, and engineering solutions contextualized to a user's experience. I do agree that these are important components of our solutions, but they have limits. So for example, policy can only do so much. Our education activities also has limitations, as well as our engineering solutions. Which leads to my next point. And this is easier said than done, but it's important. Our policies and engineering or infra solutions should make the right behavior easier, if not the default thing to do. So let me repeat that. Our policies, our engineering and infrastructure solutions should make the right behavior easier, if not the default thing to do. So one of the great things personally I've experienced, because I've been biking to work initially out of need because of the pandemic. Then eventually I got into it because of the health benefits. So when the different designs of protected bicycle lanes, of course according to the type of road, some of it really made it easier for both cyclists and motorcycle riders to be separated. While others, hindi mo talaga maiwasan, magkukurba-kurba sila, nag-aahas sila sa daan. And this can contribute to our road crashes. What I'd like to emphasize is a simple solution there, an engineering solution, can make the separation the default behavior. They won't even have to think na pasok ako doon kasi pwede. So that's the first. The second point is that our policy and engineering solutions should be contextualized to our users' experience. I think it was mentioned by our presenter from MMDA that volume is a risk factor for crashes, which is why it was a welcome idea when the first presenter noted alternative modes of transport as part of the solution to road safety. Specifically, they considered service contracting. So I think these paradigms of thinking about solutions for road safety extending to our clients' experience can be beneficial in the long run and can provide us more data and models that we can use to explore other solutions. So these ideas like the service contracting, alternative modes of transport will not only provide the reduction of risk by decongesting our roads, so it can also promote livelihood for those who have been adversely affected by the and promote healthy lifestyle through active transport. So those three quick points that road safety is our shared responsibility. And second, the shared responsibility demands that we look at the right mix of policy, education, and engineering solutions because they will have each of their own limits. And the third, the solutions based on policy, education, engineering solutions should be contextualized in our users' experience because this would enable the right behavior to be the default thing to do and easier to be able to contribute to road safety for all. Thank you.
Thank you, Dr. Regala. We have reached a lot of questions from the audience, but we apologize that we have no more time for question and answer. Please put your questions on the link shown on the screen and we will pass them to our speakers for the day.
We thank everyone again for taking part in the second webinar on road safety, a decade of success ahead. For the evaluation form, please log in at the link provided on the screen. This is a requirement for the certificate of attendance. We also invite everyone to join us across all our upcoming sessions. You may register at the link on the screen or by scanning the QR code. May we call on Dr. Ted HERBOSA to synthesize this session and provide his closing remarks.
Reducing road traffic deaths requires paying more attention to the needs of everyone using our roads, drivers, commuters, pedestrians, among others. As our speakers mentioned today, promoting safer roads should be a collective responsibility of everyone. With a high number of road crashes in our country, we must be committed to lower the numbers each year. There are challenges in achieving Pillar 2 as discussed by our speakers, and many still need to be addressed. The quality of road network is essential in preventing road crash. Road holes and bumps can cause road crash incidents. Efficient intermodal integration is key to mobility. When we take several rides to work or to our destination, it should be seamlessly connected and we do not have to walk distances to get to our final destination. We need to ensure that the public transport system, such as the public utility vehicles, the transit systems, our MRTs and LRTs, mainly bring people to their destination. The local and national government units should also increase the road space for commuters. As of now, commuters comprise 70% of total trips in Metro Manila, but only 20% of road space is allocated to them. Mobility is the right of every Filipino. Corollary to this, we need to ensure safety in the mobility and movement of people on the roads. In the next weeks, we will see the importance of enhancing the behavior of road users, most crucial as well. We should continue enforcing traffic laws and standards together with constant public awareness strategies to reduce drunk driving, overspeeding, and other harmful road practices. We also look at how improving post-crash response is key to road safety. We aim to improve the ability of our health systems to provide emergency services and treatment to crash-related emergencies. Long-term rehabilitation for crash victims will, of course, be included. We thank everyone who made this webinar possible. Again, mark your calendar every Wednesday for our upcoming sessions, wherein we will dig deeper into the post-crash response and evidence-based research and programs on road safety that we have in the Philippines. We encourage everyone to join us next week by registering using the QR code on the screen or the Zoom link below, or through our Facebook and YouTube links. Again, I end by saying that road safety is everyone's responsibility and should be everybody's accountability. Thank you. Mabuhay ang NIH, UP Manila, mabuhay ang Department of Health, mabuhay ang PCHRD-DOST, mabuhay ang Pilipino.
Thank you. We hope to see you again, everyone, next week.
Mark your calendar, June 9 and June 16 for our next series.
Surely, road safety is everyone's responsibility and should be everybody's priority.
Be safe on the road.
Mabuhay!
Mabuhay.